Alright, مشاهدي ومشاهدات قناتنا قناة كونسان سيدنا بساعة السودان، صباح الخير لكل منكم وطابت ظهيرتكم ومساء الخير لكل منا أيضا. حلقتنا اليوم حلقة خاصة تتعلق بالأوضاع الإنسانية في بلادنا. سنتحدث فيها عن مرض الكورونا. كما أعلنا في اليومين الماضيين، لقد تابعنا جميعا منذ العام الماضي انتشار جائحة الكورونا في المعمورة، بداية في مدينة ووهان الصينية، وسمعنا بإحصائيات كبيرة عن حالات الإصابة والوفيات. وأعلنت منظمة الصحة العالمية عن حزمة من الإجراءات الوقائية من ارتداء أغطية الوجه وغسل الأيدي بالماء والصابون باستمرار، وتجنب المسافة والالتزام بقواعد التباعد البدني. وشرعت كثير من حكومات الأرض في تنفيذ هذه الإرشادات، كما سارعت إلى عمليات الإغلاق لاحتواء الجائحة وحماية مواطنيها من الموت. حكومة جمهورية السودان الجنوبي واحدة من حكومات الأرض التي أعلنت عن الإغلاق أكثر من مرة، لكن من الواضح أن الإغلاق لا تكون ساريا بعد الإعلان. وفي أعقاب انتشار المرض فقدت البلاد منذ العام الماضي حتى اليوم خيرة نسائها ورجالها، ولا تزال البلاد تفقد المزيد من الأرواح رغم العوامر الإغلاق المتكررة. سنبحث اليوم في نقاشنا قضية ارتفاع حصيلة الوفيات والإجراءات الوقائية التي اتخذتها الحكومة للحد من انتشار الكورونا. ضيفنا اليوم هو الدكتور أجاك مخور، استشاري الجراحة العامة وعميد كلية التمريض والصحة العامة بجامعة جوبا، وهو أحد الناجين من هذا المرض الخطير. أصيب بالفيروس الناتج مرتين في شهري مارس وأكتوبر من العام الماضي. وعلاوة على كل هذا، الدكتور أجاك مخور عضو اللجنة الطبية الاستشارية، اللجنة القومية لمكافحة جائحة الكوفيد-19. وسنناقش أيضا هذه المواضيع في 3 محاور اليوم. نركز في المحور الأولى تعريف الكورونا والإجراءات التي اتخذتها الحكومة لمنع انتشار، أيضا جهود الأطباء في التوعية بمخاطر الكورونا وتحديات استقبال حالات الإصابة. أيضا في المحور الثانية التعريف وتجربة الشخصية لضيف مع الكورونا. إخوة المشاهدين الأفاضل، كما ذكرنا لكم إنه نركز اليوم في كورونا فيروس، وإنتم ملاحظين اليومين ديل في وفيات بصورة غير عادية في العاصمة جوبا. مرحب بك الدكتور أجاك مخور في البرنامج، ونحن سعداء جدا بوجودكم اليوم ضيفا على concerned citizen of South Sudan للحديث عن هذا الموضوع الاستراتيجي المهم الذي يتعلق بحياة وبقاء شعبنا. قبل أن نسرع في تناول هذا الموضوع، أود أن نرحب بالدكتور أجاك مخور، وأيضا نريد أن نعطيه دقيقة أو دقيقتين لتهيئ مشاهدينا الأفاضل. دكتور أجاك مخور، تفضل. نرحب بك في concerned citizen of South Sudan اليوم. أهلا بك.
شكرا أستاذ جون كورميول وكل مشاهدي برنامج concerned citizen of South Sudan. أنا سعيد إنه يتم استضافتي عشان نتحدث اليوم عن وفيات مرض كورونا COVID-19 في جوبا بصفتي المهنية كعميد كلية التمريض والصحة العامة، وبصفتي برضو كزول ناجي من هذا الفيروس. وشكرا لخالد.
شكرا دكتور أجاك مخور. وأنا كمان أيضا أنوه على مشاهدينا الكرام إنه دائما كما عودناكم we agree to disagree. In this very humble forum, we do not condone any vicious attack, derogatory, foul languages. Would be dealt with. This is the way we conduct ourselves as usual. So let's move on. دكتور أجاك مخور، أنا دايرك تحدثنا الإجراءات الوقائية التي اتخذتها الحكومة للحد من انتشار كورونا، أو أيضا خلينا من إجراءات الاحترازية. أنا دايرك تعرف لنا لمشاهديننا مرض الكورونا في حد ذاته، يعني ما هو الكورونا؟
شكرا. المرض الجديد ده اللي اسمه كورونا بيسموه مرض كورونا المستحدث أو the novel coronavirus. هو سموه مرض مستحدث لأنه ما اكتشفوه قريب يوم 31 شهر 12 2019. It was discovered on December 31st of 2019. عشان كده سموه كورونا، فيروس كورونا المستحدث أو نوفل كورونا. لكن هو بينتمي لعائلة كبيرة من بدري موجودة عائلة كورونا في فيروسات كبيره الحجم وشكلها تاج زي التاج اللي بيخطوا في الراس، عشان كده بيسموه فيروس كورونا. وبتسبب يعني امراض شبيهه بالنزلات زي الفلو، وبتنتقل عن طريق الاستنشاق بالنفس اللي بتخليه يتنقل، واللي هي through the droplets respiratory droplets. فكل العائلات بتاعت كورونا فيروس التاجي بيتنقل عن طريق الاستنشاق. فيروس كورونا التاجي الجديد ده عنده انواع كثيره، وهو رغم انه في الاول عرفوه كمرض بتاعت respiratory disease او مرض بتاعت اجهزه تنفسيه، لكنه هو في الحقيقه هو مرض بيصيب كل الاجهزه بتاعت الجسم، لانه بيعمل مايكرو كلوتينج، بيعمل تخثرات في الدم، يخلي الدم يتجلط، عشان كده بيصيب الزول بالاعياء، بيكون في حمى وفي اعراض كثيره. وهو مرض بيصيب كل اجهزه الجسم، لكن بينتقل عن طريق التنفس.
نعم. أشكرك الدكتور أجاك مخور، دكتور أجاك مخور. أنا داير تشارك مع مشاهديننا مشاهدي قناة كونسان سيرة نفسها السودان اليوم. أنا كما ذكرت في مقدمة البرنامج إنك أصبت مرتين في عام الماضي، في شهر أبريل وفي شهر أكتوبر. دايرك تشارك معنا تجربتكم الشخصية مع كورونا بصفتكم شخص نجا من هذا الفيروس القاتل.
شكرا. طبعا التجربه بتاعتي بالذات الاولى، التجربه بتاع الاصابه في نهايه مارس، هو شاركته ونشر حتى في البيج بتاعي. انا كنت من الكونتاكتس بتاع الحاله السادسه، وبنذكر المستمعين انه الحالات اول حاله اتلقت في 5 مارس في جنوب السودان، وبعد ذاك الكيسز بقى يعدوهم، الكيس الاول، الكيس الثاني، الكيس الثالث، لغايه الكيس الخامس والسادس هم الانتشار بقى اكثر. الكيس الخامس كان مصيب الكونتاكت بيرسونز كانوا 28، والكيس السادس كان معانا لو الناس تتذكر كان الدفن بتاع المرحوم القائد ادوارد لينو، كنا 101. من ال 101 ديل انا كنت من ضمن الناس. ولما اعلنوا انه الكيس السادس معانا، انا بديت اعزل نفسي لغايه اليوم ال 13 13 دايز حتى بدات تظهر لي الاعراض. انا يعني اجريت التيست في يوم 6 شهر 4، والنتيجه طلعت بوزيتيف في يوم 9. بعد ذاك خشيت يعني 8 يوم 9 ويوم 10 كانت ايام صعبه بالليل خالص. الزمن ذاك طبعا برضو المعلومات المتوفره عن كوفيد 19 كانت بسيطه جدا، والناس ما دايره تعلن ذاته انه هو مصاب. لو بنعلم انه ما في زول كان اعلن نفسه انه انا عيان، فبقيت كطبيب عندي مشروع يعني مسؤوليه اخلاقيه خلاني اعلن كزول مصاب، وبالذات بقيت اول زول في جنوب السودان يعلن انه هو مصاب بالفيروس. وكان برضه معي زميلي استاذ تيم كان معي في رحله، تيم سايمون، نحن اعلنا من نفس اليوم، لكن قبالنا ما في زول كان اعلن عن نفسه انه هو مريض. فالتجربه كانت سيئه جدا، الناس بتخاف منك، وزائد انه الاعراض اللي بتجينا يعني كان قلق وتعب، انت بتحس انك داير تموت. فما تجربه سهله، كانت تجربه صعبه، لكن كتار وقفوا معنا ووثقنا الحاله دي، وفي ناس استفادوا من تجربتنا. كحاله بدائيه بدينا ادويه كثيره لغايه ما الناس العلم استقر لانه في ادويه معينه تستخدم بعلاج المرض. في الحاله الثانيه شهر 10 ما تكلمت عنه كثير، لكن كنت تعبت فيه اكثر. نحن ممكن يعني برضه نفس الاختلاط، ولانه نحن قاعدين في المستشفى فبرضه جادني، ولكن تعبت اكثر من المره الاول. second time was worse من المره الاول.
اوكي. شكرا دكتور أجاك مكهور. بس انا دايرك تشرح لنا اكثر، لان عندنا ناس كثيرين في بعض الاحيان بيصيبوا بكوفيد 19 او كورونا وما بيكونوا ملمين. انا دايرك تشرح لمشاهديننا اعراضه بديتيلز، اعراضه، وانت عندك الحريه تتحدث بلغتين انجليزيه او عربيه. انه النقطه بتاعت الاعراض دي ناسنا يعني احيانا هم ما بيكونوا فاهمينها، بيقول يمكن ده وجع راس بسيط بس وكده. فكده ادينا ديتيلز عن اعراض بالضبط كده.
هو طبعا دي واحده من الحاجات اللي فيها مشكله بتاعت الاعراض. It's one of the big problems انه لانه 80% من الناس بنسميهم asymptomatic، ما عندهم اعراض، ودي بتغش الناس. في ناس كتار بيتفاجئوا انه يقول لك انا اصبت لكن ما في اعراض. فالاسيمتوماتيك ده اللي خالق لنا الكونفيوجن، اللخبطه اساسا جايه من الناس اللي ما بيظهر لهم اعراض. those who are asymptomatic are the one causing confusion within the community. لانه الزول لما يسمع انه ده عيان وما عنده اي اعراض بيستغرب انه كيف انا يقول لي عيان وانا ما عندي اي حاجه. هذا 20% دائما او في معظم الحالات يكون عندهم comorbidities، عندهم امراض ثانيه مصاحبه. وزي ما قلنا قبل انه الكورونا ده مرض سيستميك ديزيز بيصيب الجهاز الدموي. فلو عندك اي واحد من امراض الدم زي الضغط يعني اذا عندك هايبرتنشن بيكون انت اكثر زول vulnerable يكون عندك to develop symptoms. فال 20% ديل بينقسموا لزول عنده اعراض بسيطه، وزول عنده اعراض متوسطه، وزول عنده اعراض سيئه، وزول عنده في كريتيكال كيس. 4 اقسام. السمبل كيسز ممكن الزول يفقد الشم، يعني يلوس سميلينج، وممكن تفقد حاسه التذوق، ما بتذوق كويس. ديل اكثر اعراض بتظهر للناس. الكيسز الملاحظتي في جنوب السودان الناس بيتكلموا عن انه هو فيه حمى، لكن في جنوب السودان الحميات بتجي بطريقه يعني متاخره جدا. عشان كده هنا الثيرمال ديتكتورز مرات ما بيشتغل. يعني الحمى كان بتجيني تلقى بس في جسمك زي الزول عنده تايفويد، بتحس انه جسمك سخن، لكن مرات is not detectable، يعني بيكون فرق بتاع 0.2 0.3%. يعني مثلا التمبريتشر بتاع الزول لو 37 ممكن يزيد لغايه 37.5 37.8 37.9، مرات ما ديتكتبل. فبيغش الناس. اذا الناس يعني متركزه على الثيرمال ديتكتورز وسكانرز بيغش الناس، يجي زول عيان ويمر عادي في الديتكشن. عشان كده الناس بتوصي بانه يكون في كوميونتي تيستينج. الثاني العياء، الزول بيحس انه تعبان، ولانه احنا قاعدين في مناطق فيها وبايات زي الملاريا، الناس بيقولوا دائما الزول عنده ملاريا. بتلقى جسمك فتران ومكسر وما قادر تعمل اي حاجه. دي الاعراض البسيطه. الاعراض الشديده المتوسطه بيخش فيه مرات تراش، يعني فوميتنج، وبيكون مرات برضه في اسهال. يعني انا في الحاله الاول ما جاني تراش، ما جاني اسهال، ما جاني فقد بتاعت شم، الا بس العياء والهلاويس. you feel hallucination at night visual and auditory، يعني هلوسه سمعيه وهلوسه يعني بصريه. بتشوف حاجات، انا بشوف ناس ميتين you see them dead people they start talking to you، وبتكون انت مقلق وزهجان. اقل حاجه ممكن تشاكل زول جنبك، and if you don't have زول معك زول كويس واللي بيفهم المشكله بتاعتك انت ممكن تكون اجريسيف. فبكون في اجريسيفنس كثير. وديل الميديوم. السيفير لكريتيكال بيجي فيه انه ضيق في التنفس. you actually you become hungry for air، انت يعني جعان عشان تتنفس and you feel that you are unable to breathe، ما قادر تتنفس. فالحاله دي بيجي بالفيو ممكن نسميه سيفير اند كريتيكال. كريتيكال بتصل لانه لو عندك مونيتورز بتشوف انه الاكسجين ساتوريشن نازل، ما في حاجه بتقدر، والكعب بيجيك احساس انه انت داير تموت. for the first time you experience انه death is very near. فالقطه بيعمل لنا لخمه في معظم الدول الناميه زي جنوب السودان، انه الناس اللي عندهم asymptomatic case زي ما قلنا معظم البوبيليشن في جنوب السودان هم young people وما عندهم comorbidities، ما بيحسوا مرات، ما بيكون عندهم symptoms، ما بيكون عندهم اعراض. عشان كده بينقلوه لناس في بيوت معاهم ناس عندهم comorbidities وبيموتوا. وزي شفناه في الحالات الاخيره دي انه بقى في موت فظيع لناسنا الكبار كل يوم ورا بعض، لانهم ديل تلقى زول عنده سكري، زول عنده ضغط، وعنده زول عنده ازمه. These people they suffer and survival is very hard for them.
So now you talk about, you know, having difficulties breathing. Have you encountered that? لما أنت كنت عيان, have you encountered difficult breathing?
Yes.
So were you in ventilators for some extent? أنت كنت في ventilators زمان أنت كان عندك difficult breathing.
No, I was not in ventilators. In fact, الكيس الأول اللي هو الانفكشن الأول أنا اتضايقت لما اتصلت على ناس الاي دي يو اللي هو المركز اللي عندنا بتاعت العلاجات. فيوم 8 شهر 4 و9 و10 دي الايام اللي كنت تعبان فيهم. They started responding then as a rapid response team. They started responding on day 10. At day 10 ده خلاص the symptoms bigger relief. So I said خلي chance لناس ثانيين يمشي المركز. لكن the critical days انا كنت داير فيه ventilation ده كان يوم 8 ويوم 9 ويوم 10 شهر 4 2020. لكن زي ما قلت لك the response was late. المركز اتصل علي بعد ما خلاص انا بقيت كويس. فقلت لهم الضيق بتاع التنفس نزل. الزمن ده استخدمت لو دوز اسبرين وبقى النفس يتصلح. في المره الثانيه I didn't know انه كان ده كورونا ده في الاول، لانه by then we didn't know انه في chance بتاع reinfection within very short period زي 6 months. فافتكرناه نفس الحاجات اللي الاول قلناه ده. I thought I was having immunity وبقينا نفكر نعالج الملاريا ده تايفويد ده ملاريا ده تايفويد until نفسي اتضايق ما جا في راسي completely انه this، لانه by then there was no registered cases بتاع reinfection بس كان حصلت في كوريا الجنوبيه and ناس كتار في الويست they were rejecting this idea. الكوريين الجنوبيين قالوا يا اخي في possibility of reinfection والناس بقت ترفض، ومنظمة الصحة العالمية ما عملت كيس ستاديز. لكن later on وانا عملنا تيست مع الفاميليز لقينا انه في reinfection after خلاص I suffered and I become almost I was recovering. لكن that was the time actually انا كنت محتاج ل ventilation. So I survived miraculously يعني بطريقة صعبة. المرة الثانية ما كنت قادر حتى يدي عشان ارفعه it was hard يعني ده بالنسبة لي كان تعب يدك بس عشان ارفعه. وبعد complete loss of appetite ما في نية لأكل، ما أقدر أكل ما أقدر أشرب ما أدري أي حاجة. يعني بتسجن الصغير بحنزوني إنه تأكل حاجة. يعني and I don't feel hunger at all and I lost weight within a very short time.
Well, Dr. Ajak Makhor, well, I'm glad you are here with us tonight and we are talking about عشان ندي التوعية للشعب عن مخاطر الكورونا. I want you to go, you know, a little bit further. أنت حدثنا عن الإجراءات الوقائية التي اتخذتها حكومة للحد من انتشار الجائحة في جوبا والبلاد عموما. الإجراءات اتخذ شنو؟
كويس. طبعا عندنا مقولة هنا بيقول إنه خديناه في البلان في النصائح بتاعنا كميديكال ادفايزر بانل انه ما في دوله في العالم وكان جاهز عشان يستقبل الفيروس بتاع كورونا. There is no country in the world that was ready to receive this COVID-19. و to make it worse جنوب السودان هو عنده ممكن يكون one of the weakest health system في العالم. لكن بعد كله كان متوقع و expected انه كورونا هيجي جنوب السودان. طبعا في الاول جاء النظريه بتاعت انه بس شغل تشاينيز، وانتم بتعرفوا انه التعامل مع تشاينا بالنسبه لنا فيري كلوز، نحن الناس بتسافر لتشاينا كثير. فالمرحله الاولى يعني للاسف كانت المرحله بتاعت ريجكشن ودينايل. يعني نحن المسؤولين بيقولوا ما في كورونا في البلد، كورونا ما هتجي، بلدنا سخن. سو في ان ذا فاز يعني ستيب ما استعدينا، لانه مما على المرض من شهر 12 31 ديسمبر 2019 لغايه شهر 4 نحن عايشين في مرحله بتاعت انه ما في كورونا في البلد. وممكن في كم كليبس كثير انتم مذكرين عن المسؤولين كانوا بيقولوا الكلام ده until the first case was discovered. بعد ما عرفوا الكيس الاول بقت طبعا مشكله، لانه كانت اجنبيه، she was a foreigner تابعه لمنظمات. هنا برضه بيجينا نشتغل على انه الاصابه ده من الناس جايين من برا، والناس بقت بعد ذاك عملت لوك داون، فاز لوك داون. ده اول طريقه عشان يحافظوا على المواطنين من انتشار كورونا. عملوا لجنه سموها اللجنه العليا لهاي ليفل، زمن ده براسه النائب الاول للرئيس، ده اول حاجه. وكل الوكلاء بتاع الوزارات كل المسؤولين كانوا بيجتمعوا وبقوا يتابعوا وعملوا استابلشمنت، استفادوا من الحاجات اللي كانت عملوها لايبولا. لانهم قبالوا كان عندنا تحديد بتاع ايبولا، فالمركز بتاع دكتور جون جرام طوالي حولوه لانه يكون مركز استقبال للمرضى بتاع كوفيد 19، وبقوا يعملوا ادميشن ويدوا سبورتيف مانجمنت. فبقى قلنا عملوا لجنه عليا وعملوا حظر بتاع اللوك داون، وعملوا بعد ذاك انه الميجرز ستارت فورمينج الكوميتيز في الستيتس. بعد فتره اللجنه دي معظم اعضائها اصيبوا، على ضمنهم الرئيس بتاعه ذاته، النائب الرئيس الاول، النائب الاول للرئيس اصيب. فبعد ذاك عملوا حلوا اللجنه دي وعملوا اللجنه القوميه لمكافحه كورونا اللي هو بيسموها هاي ليفل هاي ليفل تاسك فورس فور كوفيد 19 برئاسه نائب الرئيس لشؤون الخدمات. بعد ذاك كونوا حاجه اسمه اللجنه الطبيه الاستشاريه اللي هو انا عضو فيه، اللي بيسموه ميديكال ادفايزر بانل فور كوفيد 19، عشان يدي نصائح للجنه العليا، لانه اكتشفوا انه معظم اللجنه العليا دي ليها مسؤولين سياسيين ومدراء كبار في الحكومه، لكن معظمهم ما عندهم باك جراوند في الطب. فعملوا اللجنه الطبيه العليا عشان يدي نصائح للجنه العليا لمكافحه كورونا. بعد ذاك عملوا بروتوكولات، we made many protocols لمحاربه كوفيد 19. هم يعني اقرب هم 13 بروتوكول، وعملوا فيه اصدارات كثيره. يعني اخر اديشن كان يوم 8 شهر 8 2020. في بروتوكول بتاع اول بروتوكول بتاع التستنج. انا في الاول ان احنا بس شغالين بالحاجات الجايه من WHO والدول الثانيه. عملنا لوكاليزيشن للحاجات ده، فعملنا جايد لاينز للتست يعملوا كيف. بعد ذلك عملوا جايد لاينز لوكال جايد لاينز للكلينيكال مانجمنت، كيف ممكن يعالجوا المريض بتاع الكورونا. انا برضو كانت حاجه جديده. وغير العلاج في المستشفى عملوا برضو جايد لاينز للهوم كير بالناس اللي سيمتوماتيك اللي ما عندهم اعراض. وعملنا جايد لاينز في الديسشارج بيخرجوا دول 200. ولانه طبعا عندنا مشكله بتاعت معامل، كان في معمل واحد المعمل القومي، فبقى انه الناس اللي ما عندهم سيمتومز يعزلوا نفسهم في البيوت ويبقوا يتعالجوا. المهم 13 بروتوكول اتعملت، واتعملت حاجه اسمها الناشونال ستيرنج كوميتي، اللجنه القوميه للاداره. دي تحت اللجنه بتاعت كوفيد 19. ففي لجان كثيره ولجان على مستوى بتاعت بوينت اوف انترست، مطارات، وفي المدينه زي نومولي، زي المدن الحدوديه كده. فالاجراءات دي من ضمنها اخر لوك داون الاخيره دي. فافتكر انه في جهود كثيره الحكومه بذلته، وفي جهود برضه منظمات بذلته لمحاربه مرض كورونا.
اوكي، شكرا دكتور أجاك. لكن انا ما زلنا في ذات السياق، يعني ما مدى سريان هذه الاجراءات في العاصمه جوبا وسائر البلاد؟ how effective الميجرز ده اللي اتخذ في المرحله الاولى؟
مش في المرحله الاولى بس، المرحله الاولى لغايه المرحله الحاليه. لو انا داير نعمل ريتنج للنجاح التطبيق بتاع الاجراءات دي، يعني مثلا from 1 to 10 I can give between 1 and 2 من 10،
which is
يعني
very low.
something between 10% and 20% انه الميجرز ده تم تطبيقه ذاته، اللي هو 10 ل 20%. وعندنا عوامل كثيره، عوامل خاصه بالحكومه، وعوامل خاصه بالمواطنين، وعوامل خاصه التطبيق للاجراءات دي هي في مستوى متدني جدا، مستوى متدني خالص.
اوكي. انا داير اسال قبل ما انا اخش في السؤال المهم هنا. How many ventilators do we have in the country في particular في العاصمة، في مستشفيات جوبا، مستشفى العسكري، مستشفى جوبا تعليم. How many ventilators الموجود؟
ventilators الموجودة حاليا في المستشفيات دي، يعني مثلا عندنا في مستشفى جوبا العسكري عندنا 5 فنتليترز، وفي مستشفى مستشفى جوبا التعليمي عدد مماثل، وعندنا قريب ل 15 فنتليترز كانوا خاصين بامراض بتاعت كلها، ما ل كوفيد 19. لكن المركز الاساسي اللي هو بتاع كوفيد 19 هو اي دي يو، مركز بتاع جونجران الامراض المعديه. عندنا مشكله بتاعت فنتليترز. اول حاجه فنتليترز انواع، عندنا الميكانيكال فنتليترز، الزول اللي خلاص وصل ما بيقدر يتنفس براو بيركبوا له جهاز فيه 2 فنتليترز، 2 ميكانيكال فنتليترز ناو لما اتكلم معاك، 2 ميكانيكال فنتليترز. وعندنا 24 اكسجين سيلندرز 24، وعندنا 41 بيت في 6 روم. العدد ده براك انت شايفه it can do nothing للاعداد الكبيره المصابه. بعد ذاك اللي عندنا ممكن نسميه مركز انعاش. التعريف الطبي it may not reach an ICU، ممكن يكون HDU، يعني مركز مراقب مكثف اكثر مما يكون غرفه الانعاش، لانه غرفه الانعاش ده اكبر من العمليه، ده ما عندنا is not available in the whole country، مش في IDU. so ولا عشان
no ICU unit.
yeah we don't have something ممكن نسميه ICU، ده ممكن نسميه HDU. يعني اقل بكثير من ال intensive care unit، بيكون بس ده high dependency unit، يعني حاجه مركز فيه اكسجين كونسنتريتر والناس تتنفس. لو عندك قدره لسه ما وصلت لمرحله انه صدرك اتقفل you can survive، انه خد اكسجين اللي هو النزل برونز اللي هو عندنا يعني في بالنخره تنفس براك. لكن if you lose الابيلتي بتاع الريسبيراتوري muscles وداير انتوبيشن، ما في زول حزيبه انتوبيتد، لانه نحن دايرين غرفه اقرب لغرفه عمليه، بيكون عندنا انستيولوجيست في المركز ده. عندنا نفرين 2 انستيولوجيست، 1 فورينا and 1 local staff، ده هو الرئيس بتاع الجمعيه بتاع الاطباء بتاع التخدير الدكتور جوزيف مكهور، معه واحد رواندي هناك في المركز. so we have 2 انستيولوجيست، وما في عندنا ادويه بتاعت انستيزيا دراجز for عشان تعمل ventilation. so ده they are doable by the way، يعني we can improve on this if we wanted to improve it. لكن زي ما قلت لك one of the things اللي هو observation، لو بعدين لقيت زمن بتاع التناقضات ده، عندنا too many committees. انت سمعت قبل شويه هذا ما انا بتلخبط، كوميتي في كوميتي these all committees. طب بتعرف السودانيين بيقولوا لو داير تخرب حاجه تكتر له لجان، يعني make too many committees بيتلجن. وده بورينا الحقيقه الاول اللي قبل انا قلته، انه الصحه في جنوب السودان، في السودان الجنوبي عندنا هنا، هو ما في يد الحكومه، it's not in the control of the government، لانه هو في يد المنظمات. يعني زي الجسم الحقيقي اللي ممكن يدير التعامل مع كوفيد 19 ده بيسموه ناشونال ستيرنج كوميتي. لكن ناشونال ستيرنج كوميتي ده كله تحت مسؤوليه بتاعت ديفلوبمنتال بارتنرز، ولا انا بسميهم للاسف نون ديفلوبمنتال بارتنرز، يعني ما تحت مسؤوليه.
دكتور أجاك، and why is that؟ لأن أساسا health system or health issue is a part of national security of the country. It's part of national security. National security, you know, why the government is not taking part of this, and government is the one that protecting the people.
اللي بفهمه فيه طبعا عنده علاقه بالتمويل. الصحه في جنوب السودان التمويل المتاح له حتى الان هو 1.8% من الميزانية القومية. والسنة دي الناس بيتكلموا إنه to raise it until 10%، رغم إنه المقبول عالميا at least بتاع Millennium Development Goal المفروض to reach until 15% من الإجمالي القومي. التمويل على الصحة هو ضعيف جدا، ما لقينا وسع بعد الظروف المالية يعني صعبة، عشان الناس ما تلخبط إنه التمويل على الصحة ما جاء بعد الحرب الحالية، من بدري نحن ما اديناه أولوية شيء، فواقف في المرتبات بس. فبتلقى إنه كل العمال في الصحة most of them have deserted even، يا خلوا البلد طلعوا برا أو within the country they've joined the NGOs، لأن المنظمات بتدفع لهم كتير، فالناس بتخلي الشغل مع الحكومة إلا بسيطين خالص you can count them، لأن عندهم ارتباطات معينة، ناس بالجامعات، ناس بمؤسسات عسكرية كده ممكن يكون متحملين الوضع. لكن البرايمري هيلث كير والسكندري هيلث كير في 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 بلدنا هي ما لاقيه تمويل، كان تمويل على انفراستراكشر، ما في ريهابيليتيشن، ما في كان تمويل على الهيومن ريسورسز، ما في قروش. فده الضوء بيخلي الابر هاند يمشي لزول بيدفع قروش اللي هو المنظمات. if the main funder is the NGO then كلام بتاع ال NGO يمشي، ما كلام الحكومه. فده النقطه الاول، انه we can make policies لكن to implement them and دايرين زول ثاني يجي يدينا قروش. يعني مثلا لو دايرين نعمل فنتليترز، تلقى انه كل المنظمات ما تقدر تجيب حاجات دائمه، they don't want to build old يعني حاجه يقعد زمن طويل، they don't want to build permanent structures. ده يجيب لك راف هول، ده يجيب فيس ماسك، ده يجيب سانيتايزرز، لكن ما في زول ده يجيب فنتليتر، ما في زول داير يبني ICU، ما في زول داير يصلح مستشفى ببيت كويس، ما في. and you cannot force them. انا اقول لك ما في بجت بتاعي. it's very complex and very painful، وما سهل.
شكرا دكتور
and
أجاك.
again above all the salaries، يعني انت عشان تجبر الطبيب ولا الممرض ولا بتاع النظافه انه يجي، السالري لازم يكون enough and it comes on time. السالري ذات ما enough ده it doesn't come on time. so انت بتحنس بس يا تعالوا عليك الله وكده. that's all.
واو. دكتور شكرا، أنا أشكرك. Based on this assessment and what we are talking about now، يبدو أن الحكومة غير ملتزمة بما تعلن من الإجراءات الاحترازية، بالدليل أن الحكومة أعلنت عن الإغلاق التام في مارس من العام الماضي، وسرعان عادت لرفع الإغلاق بعد أكثر من شهر، وعادت المناسبات العامة في فريدوم هول والأحياء في العاصمة، وتجدد الزحام في الأسواق، واستمرت الناس يعيشون حياتهم بصورة عادية كأن شيئا لم يكن. وفي تلك الأثناء ارتفعت حصيلة الوفيات، وفقدت البلاد رجالا ونساء كان يمكن إنقاذهم. كما نظمت الحكومة عبر شخصياتها موالي لها حفلا للفنان التنزاني الزائر معروف دايموند في احتفال أعياد الميلاد كريسماس نهاية السنة المنصرمة، وهو حفل خاطب فيه الرئيس الجمهورية شخصيا في ساحة الدكتور جون قرن التذكارية، ولم يلتزم فيه الناس بقواعد التباعد البدني. ما تعليقك دكتور أجاك مكهور على الكلام ده كله؟ إذا كان رموز الدولة they are breaking lockdown، أنا دايرك تعلق على النقطة دي.
كويس. شكرا للسؤال ده. I thank you very much for this point. لكن أنا عندي فهم مختلف. I'm not talking of إنه the government is not able to do. ما كلام إنه الحكومة ما عندها مقدرة لتنفيذ.
نعم.
الشغل ده أكبر من كده. It goes down لغاية البوبوليشن بتاعنا، إنه the perception البيليف ذات إنه كورونا في عندنا جنوب السودان الناس ما بتؤمن به. وجامعة جوبا عملت ريسيرش قريب ده في وسط بتاع الأسواق والجامعة محلات كثيره ايفن عندنا في جامعه جوبا. The students don't believe انه في حاجه اسمه كورونا. خليك من سياسيين. لما نقول لهم التزموا باجراءات بتاعت الكورونا بيشيل الماسك بتاعه بيخش في الباب، لما يخش جوا بيقلع الفيس ماسك. لما تقول له ما لا، يقول لك يا اخي ده تاكل قروشكم ده وكلوا. سو عندنا as South Sudanese we have an issue. وعشان كده احنا دايرين نبقى زي التنزانيين. التنزانيين they don't believe in كورونا. That's why ما عندهم لوك داون. فانا بالنسبه لي المساله اعمق من قدره الحكومه وعدم قدرتها. احتمال هسه بعد ما الناس بقت تموت بالذات ناس معروفين people will start now taking it serious. لكن it will be too late and I'm expecting this اكثر من كده. اذا انت لاحظت الناس اللي اصيبوا ناس مسؤولين كبار including myself and the rest. so ما عدم قدره، لانه الناس دي ذاتهم ممكن تصاب، لكن عندنا يا denial يا rejection يا we don't know. so الناس ما بتؤمن بانه الكورونا بيقتل. واحدين يقول لك احنا قعدنا very many years we're fighting كورونا بيعمل شنو؟ او كورونا is just a flu ده نزله ما بيعمل حاجه. وده ضعف واحد من البيلرز الاساسيه في محاضره كورونا اللي هو بيسموه ريسك كوميونيكيشن. الناس احنا ما عملنا كفايه في ريسك كوميونيكيشن، لانه سيمبل راجع الكلام الاول قلناه انه الريسك كوميونيكيشن ده ماشي يعني الناس تعرف ان الكورونا بيقتل الناس، والكورونا ده ما حق خواجات ما حق بلد بارد. ده اول حاجه زي هسه بنتكلم معاك في اللايف ده. very few people who have access ل smartphones ول network they already are educated or they are around the world. لكن هنا الناس ممكن تسمع روادي، الناس بتمشي للكنائس، الناس بتمشي للمساجد. these are the means of communication. so if we took the wrong approach اللي هو we want to follow حاجه طبقوها في استراليا بتاع لوك داون بتاع ما بينفع هنا. we've been very vocal في ماب. we should not copy and paste. يعني sometimes people are copying measures ما بيشتغل هنا. يعني انا مثلا personally I'm against the lockdown. ما بيشتغل في بلد زينا ما فيه social insurance، ما في اكل بوزعه.
اوكي go ahead تفضل.
لكن we need to make the citizen believe انه مرض ده فيه and it is their role to protect themselves, to follow social distancing, to put face mask and frequent hand washing. ان احنا اكعب ناس في العالم في التعامل بالريسبيراتوري سيستم. ريسبيراتوري هايجين اذا واس تلقى زول بيتمخط بيمسحوا بيدينه بيسلم على الناس. تسمع انه في بيكا زول مات بكورونا still people go لفينرال. احنا بنلاقي مشكله المستشفى يا اخواننا الجثه ده مصاب، لا دارين يكوركوا وينقلوا البلد والناس كلها تتلمى في نفس اليوم بيكا بيكون في زول ثاني مصيب. نفس الاستهتار ده اعراض بيعملوا. so it goes deep the community. now بالنسبه لي عشان انصحهم I think انه مش restriction بس we need to involve the leaders that the communities listen to. ده كلام قلت لك. انت بتعرف انه الحاله بتاعت polarization بتاع السياسه تخلي الناس ما بتصدق political leaders كتير. so in South Sudan people don't believe political leaders. عشان كده كان في تيم جاء من انوهي من تشاينا يوم في شهر 8 to assess our readiness. ولقوا انه we need to involve actually they recommended we need to involve community leaders in transmitting corona message. لانه the church leaders ناس امام our communities believe them more than the politician. كله لو في سياسي قال حتى لو اعلى زول في الدوله بيفتكروا انه وراه في حاجه there is a benefit او عنده intention. دارنك في يعني هسه اللوك داون هسه الناس عامله فيه معلومات مغلوطه كثير. they don't believe it is their health. ممكن تقفل الكنيسه، ممكن تقفل الجامع، ممكن تقفل المدرسه، لكن السوق you cannot close it لانه ناسنا South Sudanese عايشين رزق اليوم باليوم. they will break it. لكن الحاجات البسيطه بتاعت social distancing and face masking دي الضروريات. فوق لده نمبر 1 للاسف يا استاذ جونكور نحن ما عندنا health public health act. قانون بتاع الصحه العامه في جنوب السودان ما باسه. we didn't pass it and it need to be passed now by our parliament. ولا the parliament should enable the president to make it as an order. ما في قانون الصحة العامة، ما في. سو لو قبضتك ذاته ما عندي قانون بحاسبك به. And the order doesn't have the power of the law. ما في. لو أنا طلعت كلام إنه لو جونكور ما لبس فاز ماسك بنقبضه. You can even take me to the court. And we don't have a bill that has been enacted into an act. قلنا الكلام بدري في ماب إنه the parliament كان ما قادرين, then they should give the empowerment to the president to make it as provisional order. قانون.
دكتور أجاك مخور، نبقى في السياق ده. في نقطة مهم جدا جدا ذكرته عن إنه why the lockdown cannot be effective in a country like South Sudan, and you already explained in the lockdown it work in the countries عندهم enough resources إنه يوزعوا أكل للناس. أنت كعضو في اللجنة الطبية الاستشارية which is اللجنة القومية لمكافحة COVID-19 National Task Forces. Yes, if there is any way into the National Task Force لمكافحة الكورونا إنه أديتوا نصائح or طلعتوا بالبرنامج إنه in order for lockdown to be effective in the country, we need the government at least. لأن في قروش يا جماعة، في قروش تا oil. There's money. There are some people living a decent life. But المساكين أو تعبانين. هل كان أنتوا قدمتوا نصائح إنه حكومة يشتري مواد غذائية temporary assistance يوزع فاصوليا يوزع السكر at least، لأن قروش بترول ده يمكن يوزوا because we are in pandemic. Okay, يوزعوا للمواطنين in order مواطنين يقعدوا indoor عشان فترات اللي بيكون فيه lock down ده يكون effective. because مواطن قاعد يطلع برا عشان داير رزق اليوم زي ما انت ذكرت قبل. هل انتوا قدمتوا نصائح or هل الجفرمنت الحكومه ذاتها طلعت ببرنامج زي ده انه يا اخي I want to save my nation, I want to save my people, let's just give them temporary assistance, something like that happen? تفضل.
طبعا we didn't go to the extent بتاع advising someone or the government انه يوزع قروش او يوزع مواد غذائيه. لانه عارفين انه there is a lot of complaint about انه finance، واحنا شايفين المؤسسات بتاعت الدوله up to now تكوين ماشيه حبه حبه. لكن لانه عارفين انه اللوك داون صعب we put protocol on gatherings, we put a protocol on school opening, we put a protocol on universities reopening. لانه واحد في الاثنين، يا اما ان احنا we protect ourselves ولا 20% to 30% يموتوا and we develop the herd immunity. So these are the options we give. لانه احنا is an ad hoc committee non binding، ما عندنا سلطه نجبر زول على حاجه سواء كان دي تاسك فورس ولا كان دي الحكومه كله. لكن we told them all the possibilities. انه مثلا لو عملت لوك داون زي انا اجاك مكهور قاعد في البيت I need food and then ناكل. اكل بتاعي it doesn't come الا من clinic when I go to my clinic. لانه my salary doesn't ما enough, my salary is not enough. So نفس الشيء apply لزول اللي بيشتغل على التالي كونيو كونيو. اذا هو انت قلت له ما تشتغل على التالي ولا ما تمشي تشتغل ورنيش اقعد في البيت بيقعد you can stay. لكن meanwhile you need to provide them with food. ولانه عارفين انه اننا more than 40% من population are food insecure. بدون كورونا without corona they floods بحروبات. already we are food insecure. So we didn't go into that thing advising. That's why we said اللوكداون ما بيشتغل بعدم وجود قروش. شوفوا حاجه بديل انه المواطن should own the process of protecting himself مش imposed. If you let me know that is the health Jonkor, then Jonkor will be asking for hand sanitizers, he'll be asking for face mask, and then البوليس او الجيش يتاكد انه في social distancing انت بعيد. then we prevent الماس gathering انه ما في تجمعات بتاعت حفلات زي الحفله بتاع ايام انت قلتوا كان في ستوب. in fact ما في زول سال as much as I know ما في زول سال اذن ذاته. وده one of the challenges. if you want to make an order ما يكون في selectivity في التنفيذ. يعني you allow me and you prevent Jonkor, it doesn't work. المواطن بيستهتر بيفتكر انه ده ما شغال. ما في زول above the law in the country, people are the same. لكن زي ما قلت لك انا it ends up انه الناس بتفكر انه ما في حاجه، ده ما فلو بس نزله ولا في حاجه. until now we are losing prominent people. قبل كده الناس بتموت بالمناسبه لكن they were not prominent. هسه الخبر البيقى انه شايلينه taking it serious is because prominent people are dying because of COVID-19.
شكرا استاذ جاك.
So من هنا what I'm saying الناس we need to have a domestic solution for COVID-19. ما imported, ما copy and paste. We cannot copy the lockdown. في ناس كتار بيفتكروا انه انا I'm not talking science, I'm talking science that انه ما في زول cannot impose lockdown while انه my salary بتاع السنه اللي فاتت انا ما قبضته 6 months without a salary and then you want to impose. ما بيجي. You can tell me go and hunt, go and farm, then اقعد بعيد من الزول الثاني. ما تعمل حفله كبيره عرس. هنا غتين انه اذا في عرس اساسي وضروري the gathering is 30 to 50 people. 30 ل 50 تشيل اذن من national task force. We applied it لكم ناس لكن في ناس they break the law. ولانه ما عندنا public health act ما في حاجه بيقبضهم الا تحنزهم. So we need the act in the place عشان لو عملت a violation you will be held accountable. So you broke the law number كده.
دكتور أجاك مخور شكرا. وعلى فكرة أنا ممكن أقول لك يعني it was so great إنه أنت ذاتك أعلنت لما أنت أصبت بالمرض ده أساسا ده سهل عمل للناس لأنه عشان زول يخاف يقول أنا مصاب بكورونا ما أقدر أقول للناس عشان الناس بعدين يكونوا بعيدين مني. Actually that's not good. You are not helping the population and we have seen يعني حتى الناس في ناس بموتوا والناس بيخجل على إنه يقول يا أخي فلان ده مات بمرض الكورونا. Well ما موت هو موت في النهاية نموت. It doesn't matter how long we live. We are going to die. We are going to die from cancer, from any kind of diseases. ده حاجات بتحصل. فأنا I commended you for being gracious enough and doing that. حاجة تاني زي ما أنت ذكرت قبل شوي إنه في ناس بتاعنا permanent they start dying, but ordinarily they have been dying for a very long time. Last week actually we lost generals in South Sudan. وبالمناسبة I would like to send the condolences also the concerned citizens of South Sudan to those we have lost for the COVID-19. I believe so 2 days ago we lost also Uncle Joseph Okel, Murabbi Ajial في education also. From here our thought and prayers to the family. I should have said it from the beginning لكن unfortunately معلش I forgot and I did not say it. So دكتور أجاك شكرا للتوضيحات وده مهم جدا جدا زي ما انت ذكرت.
انا عندي بوينت ده اقوله حول انه ليه اعلنت. نمبر 1 الكورونا كوفيد 19 ما عنده علاقه باخلاق بمورال. So this is what I've been telling people. They should not feel disgraced انه يقول عندي كوفيد. ده حاجه بتنقل بالنفس. So it's not HIV, it's not hepatitis عشان يقولوا انه you are involved in immoral act.
Yes.
That's why we encourage many people. لما تعلن you will let other people that are related to you يكونوا بعيدين منك. وده message we need to tell them when they know that you are sick or you are a contact they'll stay away from you. For those who hide it actually they are committing a crime. يعني لو ما crime against the state they crime against the humanity and against the moral. لازم توري الناس انه انت عيان عشان الناس تكون بعيدة منك عشان ما تصيبهم. ففعلا زي ما قلت we lost many people. One of the people I respect even in their death was a late Tilar. Tilar Ring, he knew he was having corona, and that's why he came and publicly wrote on the Facebook, Ana indi corona. ما في ناس كتار بعمل زي ده. So my salutation to him in his resting place. who كان one of the strongest people who sent عشان كده يزول كان contact بتاعه بيجي يعرف إنه something corona. طبعا we lost generals زي ما قلت أو ده حاجة بطال and I send my condolences to the families, the colleagues, the comrades. لكن it tells us that corona is real. ما هزار.
Right. شكرا دكتور أجاك. وزي ما انت ذكرت قبل عندنا مسؤولين في الدوله وانت ذكرت الكلام ده في الاول قبل كانوا بيستهتروا ويستخفوا بانه ما في كورونا زادوا على راسهم. وزير الاعلام كان قال الكلام ده يا زول قال ما في كلام زي ده ما عندنا كورونا في جنوب السودان. At the end of the day اصيب بمرض COVID-19 which is we should listen to science, we should listen to health official. That actually the way it is. We should not deny it. انت لو عندك if you are feeling انا twice like شهر 3 السنه اللي فاتت انا قاعد في امريكا بلد فيه امكانيات صحيه كويسه جدا جدا. انا مشيت مستشفى انا قلت يا جماعه عندي كورونا but it will not detectable that time فعلا. لان انا مشيت عمل لي تيست وقال يا اخي it was not detected. انا قلت ليه detected not detected because what I know في ناس طب بيقول دائما negative or positive. قال because this thing is new, so نحن قد يكون عندك ونحن ما عارفين فما ممكن نقول لك negative or positive. So actually I felt like because the way they were explaining اعراض تاع كورونا I felt like انا كنت عندي كورونا لكن انا وريتهم انا قلت لهم يا اخي عندي كورونا. So ما عيب علينا الناس يقول يا جماعه انا عيان because when you say that you are protecting other people, you are making them taking caution عشان هو كمان ما يبقى دي. لانه الناس are different. في زول زي ما انت ذكرت قبل اعراض بتكون خفيفه وبيبقى كويس وفي زول ثاني طوالي البتاع ده بيقتله فايز نوت ايزي. سو نستمر في الحلقه دكتور اجاك مكهور ونقول هنا واضح ان هنالك تقصير. ده حاجه we cannot deny. واضح هنالك تقصير واهمال بل وفشل من جانب الحكومه. we have to say this في فرض اجراءات السلامه من مخاطره الكورونا على المواطنين بقوه القانون، وقد ادى ذلك الى ارتفاع الاصابات ووفيات بعدد مخيف في جوبا اكثر من اي مدينه اخر في البلاد. كيف تعلق على هذا الامر؟ لأن الموضوع ده واقع يا دكتور أجاك، الناس بيموتوا كل يوم ونفس الاثوريتي ذاته زي ما انت قلت قبل ده سو سيلكتيف. في مناسبات بيتعمل في فريدوم هول، في مناسبات ما بتتعمل. انا دايرك اتعلق على النقطه دي.
زي ما انا قلت قبل انا يعني في عسكريه when you have a war you bring your best commanders. You bring your best commanders to operate that war. This COVID-19 is new. It's a big challenge. It's a national security issue. Yes. We should bring our best brains to come and run it. This is number one. Number two, we should liberate our health system from the domination of the NGOs. لأنه أول حاجة ال NGOs بيقولوا إنه we don't have human resources, professional human resources in the country. ده أول حاجة بيقولوا, which is wrong. And this failing in the system started in 2006 when القطاع الصحي قطاع التعليم سلمناه للمؤتمر الوطني. You remember well لما CP عملوا الوزارات بتاعت الصحة والتعليم في السودان سلموه للحركة الشعبية. So في جنوب السودان we did the reciprocal, we did the same thing. رغم انه في السودان في زمن داك زمن الانغاز ال health and education were completely private while the reverse was here in South Sudan. These services sectors were public, not private. So لما تسلموا لزول تاني والزول ده بيبقيوا حقه. So since 2006 when the government was formed, the NGOs are telling انه ما في professional, ما في capacity, ما في human resources in health. And they want to maintain this. That's why I call them non-developmental partners. Then لازم نبقى زي دول تاني زي Rwanda. We should not accept dictation from other people. لازم نعمل حقنا. We need to liberate health. Our health is not liberated. We need to liberate it. This is number one. أنا ما أقدر ألوم زول، ما أقدر ألوم حكومة، لكن I want to tell them as one, a government official. I'm a government official. I want to say our health is not free. It's not liberated. وما ممكن نعمل حاجة ما في يدنا. human resources fee. I have many people who are specialists. They came back to our country, لكن they were not absorbed by the system. Or they were absorbed by the system and the system didn't retain them. ما قادر يثبتهم. لأن أنت بتدي أكبر salary لزول بيطلع something like 8,000 جنيه. 8,000 جنيه ده something like I don't know whether it is $10 to $15. للأخصائي. If you pay a specialist $15 per month, بيجي قاعد كل 6 شهور, you will never be there. So I want to admit, our health system is failing if it has not yet collapsed. وده needs a courageous decision to look into it. نعمل مؤتمر بتاع الصحة. COVID-19 there is a good chance for us. It has exposed how weak our health system is. بدل ما نكون نفتش إنه who was wrong, let us admit it is our wrongdoing and let us start correcting it. I'm one of the people who is ready to participate of putting it on the right way. Masab, it's not that difficult. We are not inventing the wheel. حاجة doesn't exist. في ناس حاولوا يعني الوكيل الجديد دكتور ميان, he tried to put a system of retaining health cadre. Yeah, we should push and help him in retaining health cadre. لأنه if you أول حاجة the human resource. If you don't appreciate the human resource you have, you will always be dependent on others. And those others who are funding, they will be dictating their own ways. والمنظمات بتعجبهم إنه يقول لك ما في ناس عشان to keep bringing people from outside, to keep bringing all the time. So I want to admit, in our system, our health system is one of the weakest in the region, if it's not the weakest. It's Amahu al-Adaf. Is among the weakest, and we need to admit it and start correcting it كلنا. Otherwise, الناس حيموتوا كتار. أنت لو ذكرت يعني in the history the Spanish flu اللي هو أول حاجة زي كورونا جاء في سنة 1918 until 1920 يعني it kills أعداد كبيرة جدا. Very big numbers from 17 million and estimated to 100 million people. نحن ال 12 million people البوبوليشن بتاعنا ده يعني ما في بيت ما عندهم كورونا. الناس they should not take it into كورونا جاي من برا. We are in the era with our community transmission. When the worst thing is Sajongkor, we have all the variants. اللي انت بتسمع بيه ده بتاع كورونا. We have them here in South Sudan, all of them. Scientifically proven. عندنا البرازيليان variant بتاع COVID-19 which is the worst. لو قبضك بتموت بعد بكره. And then we have the South African, we have the British, we have the Ugandan, we have the Chinese الأول اللي هو actually is friendly ما بيقتل بسرعة. So at this level we are under attack بتاع COVID-19, and it is an issue of national security. We need to mobilize all the health brain نعمل video conference and we put things on the right, and then we need to strengthen وزارة الصحة لأنه this is the implementing agent في الدولة. حتى الناس في الجيش ولا في الشرطة ولا وين they should be following what the Ministry of Health says. So, and above them legislation بتاعنا we need to pass our legislation بسرعة. إنه what is the Public Health Act to be passed as a matter of urgency. ما حاجة few politics. We are not telling someone you are failed and the other one you are winning. No, people are dying. أنت شفت ما في زول بيجي ما عيان. There are very few, even at the level of the government. There are very few people who are lucky who didn't get it. In the health sector, we can say up to 90% of people got it. Then we are exposed. We don't have PPEs. عندنا اللاب بتاعنا our public health lab was evaluated by the Chinese. I have the report. كان بطال. ما عندنا safety للناس. It was high risk. The national laboratory, forget about the new labs اللي فتحوهم اللابات بتاعت private. The national lab was considered as high risk. اللاب ذاته انت ما تعمل فيه تيست مش المستشفى. So if people at the national public health lab are at high risk and most of them got infected, actually most of them if not all of them they become infected, then who is safe? Who is safe? You will just live by chance or luck attack or by miracles. So we are under real attack by COVID-19, and COVID-19 it's controlling the country. It's a bimsik naib rais al-awwal wa naib rais al-tanin wa wuzara. Then it's controlling the country. It's controlling the country, and it should be treated as a matter of urgency. By Aizol, unashil bata siyasa. You forget about politics and deal with it like that. If I'm the one doing wrong, they should remove me and bring someone who will be khattat in the right way.
شكرا دكتور أجاك مكهور. انا داير ارجع ورا شويه في سؤال كده انا المفروض كان اسالك قبل في حوارنا وكده تكلمنا عن فشل انه الشعب ذاته they are not cooperating. انت قلت يا اخي المواطن ذاته they are not cooperating. الناس بيخش جامع جوبا بماس ولما نخش جوا بيقوم بيطلعوا الماس لما نخش جوا. انت قلت ذكرت انه هنالك عوامل خاص بالحكومه وعامل خاص بالمواطنين في تنفيذ الاجراءات الاحترازيه. ما هي هذه العوامل دي؟
كويس. العوامل الخاصه بالمواطنين زي ما قلت قبل هو perception. اول حاجه البرسبشن about disease. يعني احنا لسه بنؤمن بالكجره. people believe still انه ده witchcraft. people still believe انه في زول عينه بطال. this is a bad eye. so it needs a lot of work. they're very deep. تتفاجأ انه متعلمين عندهم the same belief. so believing in science انه في فيروس بكتيريا في germs it's still very far. so لما اتصل زول زي ده عنده the same belief انه the way of getting disease جاي من witchcraft ولا جاي من bad eye, it's very hard to convince them انه ده جاي من handshaking. number 2 عندنا strong culture. يعني اذا لقيتك انت استاذ جونكور and I don't shake my hand with you, I will feel انه انت you ignore me. انت جاي من امريكا and you don't shake my hand, you feel embarrassed. if I don't hug you, I feel embarrassed. You know, ليه استاذ جونكور ما عمل hug? we have been I did not meet him for the last 20 years. فده عادات الكثرة الإيطاليين. Italian قالوا له we don't shake hands, we don't hug. How we come? How are we Italian? The same thing بالنسبة لنا. You know بيقول لك لو أنا ما سلمت لزول بيدينه I shake his hand and I hug him, then how are we South Sudanese? الثاني تلقى زول عيان, we talk of isolation, they are doing bigger for crowdness. And I've seen it in many areas. When you are sick, أنا كعيان أنا dare people to come to me. Instead امبارح ده أنا جاي من زول هو قاعد في نص أولاده وأي زول بيبقى له جايو. People are coming to him, greeting him. So then this is one of the cultures أنا قلت قبل related to public perception about disease. It's not a government. ده بتاع الناس إنه these strong cultures اللي داير تعمل handshaking, داير تعمل hugging, you want to be close to people. البكا زول مات يقول عنده كورونا, لا you want to take them personally, you want to touch. داير خيلان يجوا and we have tribes. يقول لك زول ده بابي فينو إلا جدو يجي. Some people even start kissing the dead. these practices للأسف زمان طبعا one of the worst thing in South Sudan. الإيبولا ده أول ما ظهر في العالم it appeared in Maridi and people died in numbers because of these cultures. يعني حكومة حتى لو منع, while people don't believe, it needs a lot of efforts. يعني إنه handshaking ده ما شغل الحكومة. It's not the government to tell me not to handshake. لأنه I should believe إنه first of all handshaking transmit COVID-19. number 2 القبيل فوق يديل. number 4 اللي هو بتاع إنه respiratory hygiene. يعني لسه شعب بتبول في الشارع, بتمخط في الهواء. and you cough, you don't use your elbow or you don't use a handkerchief. So they practices which are very disgracing and they are helping the transmission of the disease. In Mauritania, they were very lucky. Like the Yabanin or Hunud, they agreed by namaste. So it was very easy for them to handshake. So that's why I'm not defending the government. Deep Akbar min the government. That's why we need to include community leaders, like the church leaders, the mosque leaders, the traditional leaders, in order to start disseminating their own. They should be owning this process. Otherwise, us South Sudanese are rebellious. Don't do this, we will do it. And people become just learned. We have been rebelling for the last 50 years. So it becomes part of our culture that what is the central government says is always we're against it. And that's my I'm against orders. I'm for pleading. When people, South Sudanese, feel they are being asked, they like being in order. Lakini za kutalam, we will make fine. I said, people will rebel, thinking it is for the government. If the It is not theirs. So that's the part of the government, of the public. On the government, who passing the law? Why are we taking more than 1 year without passing a Public Health Act? Number 2, لما نقول ما يعني application بتاع laws في مطار if you come in the entry انت مسؤولين كتار they oppose being screened ما داري يعملوا لهم screening. عندنا documented cases where top officials refuse to be screened. عندنا forging of documents. You find top officials violating these things. They are forging documents that بيقولوا هم COVID-19 free while they are COVID-19 positive. We have many people, we know them, and they are government officials. These are the violations دي دور بتاع الحكومة انه and then selectivity. جون كور ما يعمل عرس واجاك يعمل عرس. ناس فلان ما يعملوا بقى ناس فلان you allow them. This selectivity in implementing the measures will weaken the government position. الناس بينظروا للحكومة انه ما جادين. لو جادين ليه بخلوا دايموند يجي يغني. Simple like that. Okay. So if we said this, it is a restriction. It is a restriction for everyone. Yeah. So that all of them are dangerous. A part of the government, very, very, very dangerous. The part of the public, more dangerous than the government even. Lanu culture that it needs a lot of things to be changed. Greeting and handshaking. ناس كتار لقيتهم يعني you feel يعني تخجل يقول لك لانه انا لو ما سلمت لزول بخجل مني. This peer pressure الضغط من الناس الاهلنا it should be changed and we use this COVID-19 to change our cultures. زي ما قلت بتاعت sneezing and clearing our nose in the open. المفروض start teaching them. Yes, in the air. Yeah. So these are the part I'm talking about.
Well, Dr. Ajak Makhor, thank you so much, for elaborating في النقطة دي. نعم, strong culture and modernization, they kind of, collide sometimes. لكن ناسنا they need to be careful. لأن ممكن you want it to be modernized and you want to hold on to that strong حاجة ممكن there are, effect now we are getting with this COVID-19. I have to hug, I have to do. I remember very well as a young boy. I used to see when there is a new baby, low matter wilted, people always wanted to come and visit Nafasa, and they want to kiss baby. And actually, that baby is vulnerable. يعني يدوب جا للدنيا كان قاعد ببطن امه بالتالي الناس كلهم عيانين عندهم مصايب في راسهم وفي نخرتهم وشنو. When you kiss that baby, the baby is likely to be infected and baby will die. And I was very objective always. خالي قاعد يقول لي ما لقيتها. أنا قاعد أقول no. لا نازل قاعد أشوف زول بيكون عجوز وعنده حاجات في نخرته ما مفهوم عنده سعود. And it will yeah, seriously, I'm not in health, but this is the way I used to think وأنا صغير. فناسنا they need to be careful. كلام أنت تقوله ده كلام مهم جدا 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 دكتور أجاك. يعني we are not going to die if we don't hug somebody. We are not going to die if we don't shake their hands. كلام فضيه وما فضيه وفلان ده شنو وزول عمل نفسه كبير. No, ده مرض. And it must be, we must address it real carefully. So we continue. أستاذ لسه مستمرين إن شاء الله. في سؤال مهم أنا داير أسأله هنا. الملاحظ زي ما أنت ذكرت قبل إنه ثقافة الإعلان الإصابات من الشخصيات المصابة أو أسر المصابين ضعيفة للغاية، وهناك تكتم على الإصابات وسط المواطنين، وبعض الحالات تعرف فقط بعد وفاة الشخص المصاب. بماذا تنصح المواطنين بخصوص هذا الأمر؟
طبعا أول حاجة التستنج ذاته in the public of South Sudan هو ضعيف جدا. الكشف. What we do is what we call في MAP medical advisor panel as a passive testing. انت داير تسافر يا دوب يعمل لك تيست. انت براك حسيت باعراض then you call يا اخوان انا زي عندي كورونا تعال اعمل لي تيست. We recommended at the medical advisor panel انه نعمل community survey. مثلا قلنا نبدا بانستيتيوشن كبيره. الوزارات دي عندها 4 ابواب. مجمع بتاع وزارات بتاع حكومه جنوب السودان عنده 4 ابواب. قلنا 4 ابواب دي يقفلوا. And we use recommended RDTs rapid diagnostic test. اي زول جاي الصباح شغل عملوا test. Good enough, it has been just done now في central bank for the first time. They've done it in the central bank, and because the leadership of the central bank accepted that and they call for it. We want other mahalat to use it عشان نعرف how much people are infected في community. ما عندنا معلومة. الأعداد اللي بتسمعوا ده أعداد, these are the tip of the iceberg. بسيط جدا. أنا ماشي مسافر وأنا عندي شنو بس, they are not the real one. So التستنج ده يبقى من هناك. الإعلان لأنه زي ما قلنا معلومات الناس بسيط. يقولوا سهروني زول شافني بعين بطال. They don't believe in this is a virus. And that's why stressing on them إنه ما في سحر فيه. ده فيروس شافوه تحت الميكروسكوب. We can see it, we can isolate it, we can even culture it. ممكن نزرعه. So we know what causes COVID-19. Here even in Juba, we can culture it. ما محتاجين نمشي سنين ولا نمشي محل تاني. So بيبدأ بالمثقفين المتعلمين اللي شغالين في الحكومة. When you have a disease, you declare it. الناس تبدأ إنه أوكي ده حاجة عادي. And then when people know إنه فلان زي أنا عيان, when I become healthy, they know إنه في chance for someone to heal. So it will encourage them. It will encourage them. فالشغل ده ضعيف جدا زي ما أنا قلت لك قبل. يعني one of them we have very low testing capacity. ما ممكن يدينا معلومة. And then we believe إنه ده جاي من برا. لكن bad enough we have reached the level of community transmission. موجود في أي county, any county in South Sudan, usual positive confirmed positive with COVID-19.
شكرا دكتور. أنا I am moving on. I hope you can have more time عشان عندنا أسئلة كثيرة.
I want to tell you one case which was very moving in July 2020. أول case in one of our towns, يعني الزول عمل تيست وسافر من جوبا. بعد ما وصل تقول له تليفون, الو معانا فلان هاي انت عندك COVID-19. شال كلاشينكوف ده طوال الطوف ضرب نفسه. So أنا ندير نوري مواطنينا this thing is not that deadly. It's true وبيقتل لكن it doesn't condemn you to death. لو زول بقى عيان you don't need to shoot yourself.
تدعالج.
تدعالج. isolate yourself. فتخيل زول أبوه مات وتاني يضرب نفسه بالطلقة. يعني what is he doing? يعني that's how perception about COVID is so misunderstood and misinformed.
نعم. دكتور أجاك مكهور, أعلنت الحكومة عن إغلاق جزئي قبل شهر, وقامت بتجديد الإعلان وتمديد الإغلاق لمدة شهر مساء يوم الخميس الموافق 4 مارس من هذا العام, وأعلنت عن مراقبة من سيخالفون إجراءات الإغلاق الجزئي. هل ستتابع الحكومة تطبيق إجراءات الإغلاق على الأرض؟
ما بيقدروا. They will not be able. And we've made our opinion very clear. أنا نشرتها في البيج بتاعي. Instead of us going into, this is a losing battle. تماشي تفقد معركة ده. As a soldier, don't go into it. Withdrawals مرات ده جزء من نصر. It helps you controlling. So we should evaluate the former partial lockdown أول.
Correct.
Were they effective? They were not. زي كلام قبل قلت لك. First of all, then we are depending on daily food breeding. بنفتش أكلنا يوميا. Even the top professional لو ما ماشي شغل ما بيقدر يأكل. So when you tell them that you are locking down and you are not giving them food, believe me, you are making a mockery of yourself. بتضحك على نفسك. And the first people who are going to break it are your household, not the معك في البيت. They're going to break it. Your father, your mother, your sisters are going to break those laws. So why do we call for something that will not work? Number 2, الثقافة بتاعت fines زي ما قلت لك قبل. أنت تغرمني 6000 and my salary is 1200. أنا أجيب لك من وين؟ Where will I get that 6000? And supposing I didn't pay 6,000, what are you going to do? You're going to take me to court. Now, court will code which mawad? You have to murder. يقول أنا كسرت جان قاضي حاكمني. The order, okay, now you will take me to a jail. The jail will be crowded, and then you ensure COVID-19 physically
infected.
So lockdown, in my opinion, as a scientist, doesn't work, and will not work in a poor country. Let people own the information and they own their health and support them. جيب شوية مساعدات، جيب رز، جيب زيت، وزعوا الناس. يا اخوانا قللوا الحركة، يا اخوانا امنوا البكيات الكثيرة. لو في عرس ضروري يكون 30 نفر، still the عرس. العرس ما شرط يحضروا 2000. It's not necessary for a wedding to be attended by 2,000. Wedding attended by 30 people is a wedding. And the right people to do this, these are the church leaders and the mosque. شوف now بالذات أنا من هنا بشيد الكنيسة الكاثوليكية في جنوب السودان. They are the best implementers. They now protocol on worship, places of worship. They put it in exactly as we wrote it. في البنش تلقى نفرين بس. عندهم entrance and different exit. If you don't come with your mask, they give you a mask, and they have sanitizers.
Yes.
So if people own this health issue, they will win. Lakin, good enough, زي ما قلت لك, I've made my personal view known. I put it in my Facebook page. Lockdown, the old lockdown didn't work, and this new one will not work, and the extension will not work. So I'm advising the authorities, since they appointed us as their advisors, our medical panel advisor. I'm advising them now to review it. Good enough. في verse هنا بقول phrase بقول pending review. Let them call us and we review it for them, and we tell them lockdown will not work. We need a different approach. We don't need copy and paste from Australia or from Germany. They do a lockdown and they manage, or China.
Exactly.
China very strict lockdown, and they told us, by the way, في evaluation that I'm telling you, when they came and assessed us, they said our health is weak. This complete lockdown, their measures, and it needs involvement of community leaders. And I have the report that the Chinese from Anhui University. These were the people who are leading the fight against Corona in China. They came and visited us, and we met with them. They presented to us a workshop, and they gave us recommendation. So if we are following science, please, decision makers, we as scientists, we are advising you again is lockdown, whether it is partial or complete. They don't work.
Thank you. Unless something like انت قلت قبل انه يكون في توزيع، يكون في اكل للناس يقللوا من مشي بتاعهم. انا هنا في امريكا وانا في
ما بيجي because even we have not get our salary. Where is it going to work?
Yeah.
We talk of our rights, not our privilege. Our right is our salary first. So if our government is unable to give us our salary, it will not be able to give us supplies, food supplies. تبرع منه. أنا ما أقدر أكون too much optimistic and pressurize them وزولين أكل. Well, I know they can't. I'm not an expert. قروش بيجيب كم في oil أنت قلت I don't know how much it is, whether it is enough or not enough. Millions. Let us fight ourselves, fight this corona, to mobilize. Mafi technique arm. We need to recruit all the citizens to be part of the soldiers fighting corona. Aizol Hezino is a nationalist and he need to fight this one. Then the supplement al-biji min al-Hukuma, it could just addition, to become an addition, not a subtract, not pressurize. We don't have an enemy from within. Al-Shab kullu, we should make them soldiers against COVID-19.
Correct. دكتور أجاك، توفى جنرالات من الجيش الأسبوع المنصرم دون أي إعلان عن سبب وفاتهم. هل لوفاتهما صلة بالكورونا؟ في 2 جنرال.
أنا ما 2، عندنا أكثر. There are very many, and some of them have already declared their status, and I thank them. So those who died and declared their status, they followed the strict COVID-19 burial protocol, and even they refused to be taken to their hometown. They were buried by our COVID-19 burial team. It is just we are respecting the families. That's why no one can declare apart from the family. Lakin, it is known to us those who died with the corona, we handled them, and our team of burial buried them. So our family ma declared they come in the family. Like even them, they were sick and they knew, and they told us they were sick. So some of the, I cannot mention their names. Again, some of the generals who died, they were very courageous. They're real fighters. They told their families, we are sick with corona, and don't bother taking us to the village because we will take corona with our corpse. So we buried some of them here in Juba by the burial team, not the family. And I thank them. Even in their deaths, that's why we treated them as martyrs. Some of them now were buried with the martyrs who died with late Dr. Jongarang. And you will find out from your own sources. So I don't know about those people who have not declared their status. Again, the top generals who died in Juba, they declared their status. To make it, no one has a right to talk about someone else in health ethics. If they were courageous enough and put it in the Facebook pages like what Tilar did, that would have been very easy to others to speak about it. Like him, because maybe they didn't have a chance of making it public. So we don't find it necessarily to talk on the other people about, flan, kata corona. Lakin, we've buried them here, Jamjaban.
Shukran. Dr. Ajak Makhor, Sudan has good mind, very smart doctor. One of them is you. أنا دايرك تحدثنا عن دور الأطباء في السودان الجنوبي في توعية المواطنين بمخاطر الكورونا، وما هي التحديات التي تقف عائقا أمام جهودكم كأطباء.
شكرا للإطراء إنه نحن we have good minds. Thank you very much for appreciating us. There are a lot of things في عوائق كثيرة. طبعا we are doing a lot of things. Part of them is this shows like talk shows. People talk on the radios, they talk on TV, they write articles, they use the social media to talk, tell people, try to convince them this corona is real and is a virus. That's one of the things we are doing. The other thing we do treatment, case management. Normal case management on daily basis, and we are vulnerable. Nas قاعدين في IDU, في Jongarang Center for Infectious Disease, and people are in different hospitals. Even emergency hospital Makafal, we are always meeting patients, even those we don't know they are positive. Like in my clinic, patients come and like I do review clinic on Friday. One day I saw 119 patients in one day, but most of them, even some of them, refuse to put on face mask. Now we are forced to tell them those who don't put face masks, they will not be able to see us. This is one of the challenges we meet. Our patients even they are putting us in danger. And then we are already on front line and we are dealing with disease. So the few doctors, if you see infections, you'll find that more than 30% of the health workers, up to 40%, got infected. So that's one of the challenges we get. We don't have enough PPEs. And بالذات الناس في الحوادث, they are always vulnerable to get disease from the asymptomatic patients. الناس اللي ما عندهم أعراض, these are the most people who can infect us. And you will wonder, ناس كبيرين قاعد تسمعهم جنرالات وhonorable they كلهم were treated by us. So we were in first line. بالذات نحن في مستشفى جوبا العسكري, all these honorables we treat them, and even if they are sick, we are the one to take the challenge and meet them. So كل اللي بيستمعوا برا اللي عندهم capacity, you need to provide PPEs. It's not the government work alone. I know هو ضروري شغل الحكومة, لكن those who have capacities of coordinating and donating PPEs, مش قروش, يعني bring PPEs, then they should bring it. Number 3, which is a very big challenge, we don't manufacture kit. It tests order, and that's why we are controlled by the NGOs. We don't have enough money to buy them. So we need to do something about it. Whether the government should provide enough kits, عشان نقدر نعمل test كتير, ولا citizens اللي عندهم capabilities, that those who are rich, نعرف إنه في businessmen in South Sudan within the country now who are very rich. They are richer than the government. So they should do something and provide testing kits يكون enough في ولايات كله. بدل ما تشيل زول من مدينة بعيدة, من رنج, من نملي, من يامبيو, التست يسافروا بطيارة يجي يعملوه في جوبا. we have something like 18 gene expert موجودة هناك. So إذا عندنا enough kit, they will be tested في محلاتهم. Now these labs are run by NGOs, most of them. يعني out of the 21 centers, be 3 private, then 1 is a public health lab. The rest, like 18 or 17, are NGOs run clinic lab. They're in local NGOs are to be able to run them instead of international NGOs and on their own thing. Number 5, we don't have unified testing kits. لأن ما قاعد نشتري هنا. إذا China اتبرعت نشيل حق China. إذا أمريكا اتبرعت نشيل حق أمريكا. إذا كده. And then a country you need to have unified testing. ده بيجي برضو availing funds. You don't have money, get it by the one who have the money.
شكرا دكتور أجاك. أنا عايز أسأل سؤالين. هل جنوب السودان يعني لقى مساعدات من منظمة الصحة العالمية بموضوع بتاع كوفيد-19؟ وإذا كان في مساعدات أيما كانت كيف تم توظيفها؟ سؤال تاني داير أسألك دكتور أجاك also بيحصل عملية testing which is بكوفيد-19 لناس المسافرين في البلد ماشيين يوغندا ماشيين أمريكا ماشيين whatever، بيعملوا تشارج لمواطن المغلوب على حاله التست ب$100. ليه التست ب$100؟ الدول دي كلها بتعمل تست مجانا لمواطنيها، ايش معنى جنوب السودان بتعمل تست بالقروش؟ وليه بالعمله صعبه؟ ليه ما يكون باللوكال كارنسي؟ تفضل.
شكرا استاذ جونكور على الاسئله دي. طبعا ده واحد من الحاجات اللي انا قلت قبل انه our health system is not yet liberated. We got a lot of donations from individuals, from NGOs. Lakin these donations, they don't and they never come direct to the government. انت ممكن تسمع انه WHO يتبرع بكم مليون كده، تخيل انه قروش ده نزل في حساب حكومة. No, they give to their implementing partner اللي هو implementing international NGO. يعني مثلا في منطقتنا الماسك المستشفيات ده MSF for example. So لو جابوا donation من WHO زار بيجي يشيل تاني ويدوا للمنظمة داك. And they choose what to give, not what we've said. يعني مثلا يجيب hand sanitizers، يجيب face mask، نقول له مثلا جيب جين اكسبرت ولا جيب PCR ولا ابني لاب، they don't do. So it's true that في ناس كتار pledges and في ناس كتار عملوا جابوا تبرعات. لكن most of the تبرعات ده what goes طبعا you know they are labeling us حاجات كتير، people are corrupt what so they don't give direct. And ده even حتى في زمن جوبا الحرب and جوبا this economical hardship we're doing the same. So we need to do like other countries and تقول إنه you want to give me, give it to me or don't bring it. ده is my advice to our decision makers. نكلم عشان أكون government should be accountable. إذا سمعنا إنه في 50 مليون جابوا WHO لوزارة الصحة، now we will become on the neck وزارة الصحة. وإذا 50 مليون تا وزارة تا WHO. لكن now we cannot ask them. لأنه بيجيب لك 10 مليون ويطبقوا هو براو. وما بزول بيحاسبهم. رغم إنه WHO is not even an UN organization. المفروض كنا فيه يد، لكن we don't pay our share. عشان كده we don't have a say. So that's about هنا لقينا مثلا أول لما عملنا auditing we did an auditing أزمات. we found إنه جابوا يعني hand sanitizer كتير الآن ممكن too much. يعني the same money could have been used for testing kits. So even نحن زادنا دايرين نكون in a way of accounting these NGOs, and they should be instead of dumping and instead of the push system on the health in 2 ways, push and pull. Should be the one pulling, not look حاجة دايرينه. نحن في جوبا دايرين lab laboratory to work. And that's why you ask إنه ليه التست بقروش. Then they give us kits 800 kits per month. ده WHO يتحكم فيه هو. So these kits are now used for the cases. أي case في جنوب السودان بعملوا test مجان for the contact and for the suspect. لأنه جاي منها. Well, that's why it was separated. The lab بتاع الحكومة ما في test في lab بتاع الحكومة. And I'm sure of this. In government labs, there is no charging. Now, a demand بتاع المسافرين above what the donors have. That's why in MAP we develop what is called travelers protocol. So there is average, and in the business, and in the grush there is average. So, and I'm ready to pay. That's why we encourage in a competent private lab to run. Now the issue is if you make it إنه يقوم يسيطر عليه شركة واحدة هيكون في manipulation. That's why we want it إنه يكونوا كتار. So when there are many, there will be في competition or السعر بينزل تحت. صح, like you said, most of the countries they do it for free. لكن in the region الزينا it is charged. In fact Kenya أغلى من Kenya and Egypt أغلى من جنوب السودان. لأن هنا بدأت $100 and now it has gone down to 40. And we encourage other competent companies. In Rwanda is $60. لكن in the other countries they interview Dubai مواطن بملوك مجان لأنه the state has bought it اشتراه. So when we don't have it ضمان القروش ده جاي للكلام الأول قبل قلت funding. If you don't give enough money for the country, if you don't have the kits yourself, أنت ما بتقدر تسيطر فيه. بالذات الزول المسافر نازل يشوف بقول لك لا this is a luxury. Why should they travel? But that's why for the cases, for the contact, for the suspect, they are tested in the public health lab. Again, for purpose of travel, this they are also بيمشي private and then they pay. Now, but it was very expensive when it was one company. Now there are 3 companies. If more came in with more competency, ممكن يكون ينزل أكتر. Now the issue again is controlling these private companies. And لازم احنا في MAP in the medical advisory panel we said the information or the results are the property of the government of South Sudan. انت عندك lab بتاع جونكور negative or positive, they are property of the government. They should be communicated. But there are some labs which are following the rules. They do the test, they give it to the public health lab. Now the public health lab عندهم rapid response team عندهم case management بينادوه. زي ما قلت لك بالفيزول نادو ضرب نفسه. It should be a psychiatrist, a psychologist هو اللي ممكن يضرب الزول. لكن the business ما فاضيين. Don't go into positive انتهى. Whether you shoot yourself or you don't shoot, they don't care. For this, the role with our government, it should be a very big. We put it as a protocol. It's not implemented now, and I'm asking them here to implement it. Any lab with our private, the information are properties of the government of South Sudan. This is a protocol we pass in MAP.
Thank you. And why are they not using the local currency? Why is it a dollar?
No, because they use, but they use the dollar as fixed. And all these 3 labs, they use the dollars or equivalent. And مثلا you are paying $40 now, most of the lab become 40. You bring either the $40 or equivalent to $40 بسعر بتاع السوق. يعني if they give you a pound, they take it.
Thank you.
Because في النهاية they are forced to take pound. Or with the business, if they strict it في dollars, they will not get it. So they are forced by the dynamics of the market. في الأول طبعا they wanted to control it. أما بيجا في الأخبار كتير بيجا في now there is no way. And that's why we're encouraging them more. يكون في more private clinic to compete with the existing one, to reduce the price to the minimum اللي هو فعلا اللي بيستحق إنه يدفعه. And then you know where you are living. لو في محلات يكون في competition بيكون السعر بينزل.
Absolutely. دكتور أجاك بمعرفتك كطبيب، هل لمستشفى جوبا التعليمي وغيرها من المستشفيات في جوبا القدرة على استقبال المصابين والتعامل معهم؟
No. أنا كده كلمتك ما عندنا مستشفى مستعد عشان يعالج severe cases. Mild cases, moderate cases, can treat them anywhere. لأنه they don't need intubation. الcases اللي هو داير mechanical support Even our IDU cannot manage them. وده is a big challenge to our government, the Ministry of Health. أنا بفتكر إنه عندهم قدرة. Until now, with the few things they have, they still can improve on what is there. لكن زي ما قلت لك قبل, most of our hospitals except Juba Military Hospital and Musivita Police, these are the only hospitals which are run 100% by the government. The rest, even in Juba Teaching Hospital, part of it is intervention in donors and NGOs. So they do what they want, what they can. So we need to do something with that. Simple, we talked about it a long time ago in Malatani, we need to introduce health insurance system. We need to pass it, we need to introduce it. لأنه الناس الpoor, they can be treated through health insurance system. We don't have a health insurance system, don't talk about public health. You talk about private, and then private for those who are able to do it, to fund it. Even the big one in the government, they cannot treat themselves. So the absence of the insurance system in the country is the biggest challenge. We need to have a separate system that will be able to back up with free. People always talk of free health service. Yes, free, like someone should meet the cost. Who's meeting the cost? The insurance. You take little money from me, little money from Jonko, little money from the rest, and they treat the rest. And like I've said, the brains are there, and we talk. We can put the system in order. We don't say it's a debt. Like in Bashir Bidla obsolete. And even if I become sick myself, when a senior consultant, my money, my salary cannot treat me. So they are mushkil asasi. Funding the health system in South Sudan is one of the poorest. 1.8. Salary mabagati. So it needs something be done and must be done now.
شكرا دكتور. أنا عندي سؤال له أبعاد عالمية. دكتور أجاك مكهور، داير أسألك سؤال ده زي ما أنا قلت له أبعاد عالمية، وهذا السؤال ضروري لك بصفتك المهنية كطبيب. ورد في تقارير الصحيفة إن دولتنا بواسطة الحكومة في جوبا طلبت اللقاح من جهات دولية لتطعيم المواطنين، على الرغم من أن شكوك عالميا حول سلامة اللقاحات التي تنتج حاليا، وهناك فيديوهات منتشرة يتحدث فيها أطباء عالميون ويتشككون في سلامة اللقاحات التي تنتج حاليا، لأن هنالك معلومات بين اللقاحات ستقضي على حياة الناس ضمن خطة تقوم بها النخبة العالمية لخفض سكان إفريقيا، سكان الكرة الأرضية وخصوصا سكان إفريقيا. أنا دايرك تعليقك على النقطة دي.
شكرا للسؤال ده أستاذ جونكور عن اللقاحات. أولا أفريقيا ما قاعد تملك لقاح لأي مرض.
نعم.
أفريقيا كله. We import our vaccines. So بعيدا من البرنامج بتاع المؤامرات الدولية، إنه في نظرية بتاع مؤامرة. I don't want to buy these ideas. إنه في مؤامرة عشان ينزل سكان أفريقيا. We don't impose population crisis. إفريقيا ما عنده مشكلة بتاع population crisis. We know where the population crisis are. في مشكلة في China، في مشكلة في India. These are billions. سكان بتاع أفريقيا ما بيعملوا أي حاجة. They are very few. So I don't buy the idea بتاع إنه في نظرية عالمية كبير عشان ينزل الناس. وده بوريك إنه منظمة الصحة العالمية is not controlled by one person. ده ما بوريك إنه ما في fraud. It doesn't tell you there is no fraud. And if people, even local people in South Sudan, they are dealing with Corona as opportunity to be rich. كلام ده فيه. So it needs people to be very cautious, not to allow the fraudulence to utilize our weak system. Lakin again, we should be even برضو strong, not to condemn a real assistance. المنظمات اللي انت بتسمعوا قبل ده،
نعم،
ده حاجه اسمه كوفاكس جاي من WHO and they are buying من companies which are well known. يعني طبعا في vaccine كتير، لكن one of the good vaccines اللي انه ممكن ينفع في دول حاره ما عنده infrastructure ده بتاع AstraZeneca بتاع Oxford University. And this is one of the recommended.
It's a German
the other thing
one.
ده بتاع Chinese, and the Chinese have used it for their population. So we have the capacity to test, and we have the capacity to control. So yes, Malcovax we've started. والدولة اللي بدأ في أفريقيا ده Rwanda. Rwanda started, and on the 2nd of March, Sudan received the first shipment. So the two things should be there. We accept cooperation Malcovax, the shield vaccine. Again, we become cautious too to find out في fraudulence. لأنه ممكن زول يجيب لك vaccine يقول له ما vaccine. لكن like I've said, I reject فهم إنه في international conspiracy against Africa. That it doesn't work with science. لأنه COVID is known, and the local staff here we can في vaccine بيعملوا testing. طبعا ما بيورينه الvaccines ما عندهم dangers، عندهم side effects. Even the proven one بتاع الأمراض القديمة اللي الناس بيعرفوه ناس polio and what, they still have side effects. So the COVID-19 vaccine is new, which means it's not safe. ما في vaccine هسه يطلعوا 100% safe. There is no. ما في. Some of them have efficacy of 93%, 95%, 97%, 98%. I've not come across a vaccine against COVID which is 100% safe. So we should be very cautious in implementing. That's why we start with vulnerable people. نبدأ بدكاترة وممرضين، نبدأ بناس police, because they're ناس crowded, ناس prisons. Then كل مرة we take a test in our lab from these vaccines. We discovered then we don't use middlemen. يعني كلام منهم تجيب وسيط وزول بتاع سمسرة في النص، ده ممكن يجيب لنا الفاكسين، ممكن يكون زرع ما بقتل لكن ما effective. Someone can sell you water, they can sell you normal saline يقول لك ده vaccine. Okay, يعني I'm not talking of just only إنه يقتل ناس. Someone may import حاجة ما effective. And then we cheat ourselves that we are protected, which is not. So زي ما قلنا الاثنين they are there. People will be very cautious about fraudulent people. Again, we don't need to lose our trust in the international bodies, the WHO, UNICEF, ICRC. they'll أجسام محترمة. These are respected international organizations that has ما لقوا عندهم يعني widespread fraudulent against a specific race. الكلام ده مرات ما doesn't work.
Thank you دكتور. دكتور قبل ما نختم الحلقة بتاعنا دي، أنا داير أسألك السؤال ده. قل لنا ماذا يحدث في جوبا بالضبط؟ لماذا ارتفعت، وأنا سألت قبل السؤال ده، ارتفعت حصيلة وفيات في الكورونا في جوبا مؤخرا بهذا الصورة اللافتة أكثر؟ هل هناك كورونا سياسية في جوبا كما يقال؟
طبعا للأسف زي ما قلت لك people بتاع الجنوبيين they have very little trust in political leaders. لو أنت قلت كلام the other one who is not your supporter will not believe you. So عشان كده الكلام لو قالوا حكومة الناس بتنقسم طوالي لأنه ده زول بتاعي ولا زول ما بتاعي. Why the cases have increased? One of the things, because the testing capacity has increased. قبل كده ما كان في testing, so people die at home in the community, they are not known. Now عندنا protocol of testing any person who died in the hospital or has been brought للموشري. Even if someone died in the mortuary, if in the at home and is brought to the mortuary, the Juba Military Hospital is being tested. And Juba Military Hospital, the one of the is the most functioning mortuary in the country. So most of the dead people are brought here. A team led by Dr. Akram, they test those who died. So now we're going to test the postmortem, not even for those who didn't die. So the scale of testing has increased. That's why numbers look like they have increased while they were already there. Number two, people who are prominent in the government, some of them are dying. That's why it become very known. Jar, Kubar. عشان كده بقى الناس بتعرف انه ايوه ده كورونا قتلوا. Number three, and which is very dangerous, we have now the deadliest variants. No, البطال as a Brazilian, you don't stay for 2-3 days. I've lost just my colleague anesthesia last week, Captain Marcelo Madio, he's one of the best anesthetists in the country, in the whole country. He developed symptoms which are chest tightness, and then within 2 days he died after anesthesia, and we had to close our places. So, and he was sick just only for 2 days. Because we have the Makutelek, and then the variants, deadliest, who are the Brazilian and the South African and the British. These three ones, and they are all here. That of Tarif, South Sudan, our people travel all over the country, all over the country of the world, and they bring in his case, which means one of the things in the muskila fil matar, and the muskila fil mahal al-dukhul. Our borders are porous and they are not under our control. We have a point of interest. ممكن يزول يخش عادي بدون ما يمر بالسكرينينج. Or you come, you test negative في محل بتاعك انت قاعد فيه في Seattle. Then when you are traveling, you get the disease. Then when you test, you don't have the symptoms. Then you enter as even you enter mind. Last thing, we should develop a way of holding someone's passports and then following them up. Then follow up and tracing contacts is very hard if it is not failing. One of our failures. In the cases and contacts. If you are not more cooperative as a traveler and you keep isolating yourself for 14 days alone, big there. And we got many people fight us, and NGOs, they wanted us to leave this restriction of Q14. لأنه حتى يوم ده الناس بتاع unionists 60 people were sick من these forces. من forces بيجي من نيبال من China من all over the world. Right? For case tracing and contact tracing is a big problem in South Sudan. It's a big problem. So الوفيات دي ارتفعت لأنه we've imported all the variants. كل الكورونا في العالم جبناه and prominent people are getting it. That's why it become more known. Otherwise, people died, many of them last year, and this year many more than this died. Again, they were not tested.
Well, Dr. Ajak Makhor, it was an honor to host you tonight in this very humble forum concerned citizen of South Sudan. في الختام أرجو أن تقدم لنا كلمتك الختامية لهذا اللقاء لشعب جنوب السودان لكل المتابعين حول هذا الفورم. تفضل.
شكرا. Thank you very much, Sir Jonkor, for hosting me and to talk about coronavirus in Sudan, both as a survivor and as a doctor consultant who is concerned for the South Sudanese like yourself. So, da Sharaf Lay, next evening, I want to declare in this forum, South Sudan is under attack by coronavirus. We should be recruited, all of us, and fight it together. And the simple thing we need to do, social distancing, face masking, and hand washing, and handshaking. On my recommendation, lockdown, whether partial or complete, is not on my agenda. We should not politicize this COVID. It is a real threat. شكرا لكم خالص. إن شاء الله يكون الناس استفادوا من اللقاء ده.
أشكرك كل الشكر دكتور أجاك مكهور. كنت لايف معنا from Juba. It was an honor having you. وإن شاء الله ده ما يكون يعني نهاية اللقاءات. هنستمر إن شاء الله. And we will continue, to monitor the situation as we want our nation to progress and get out of this mess. شكرا جزيلا. Have a lovely night. أشكرك.
Thank you.
All right, here you have it, viewers of Concerned Citizen of South Sudan. With that, I'm going to go for a break for 3 minutes, and then I will give an opportunity for you to come and weigh in your perspective and your opinion in that. So let me go ahead here and do this. And yeah, so let me go ahead and do a break here. Let me give you this gentleman for a break, and then we'll move on from here.
And Ajak oh my God. Nelly Jato, we jagam my love. Jagam my heart. Nelly Jato, we jagam my heart. Put them on. Yana willing them. Will it go down? I'm so in love. Oh my word. You can be none there. Oh my word. Nothing but Banduna. Bangi to Banyu to know. We need to Bajal got to know. And Bajal got to know. Met the guy in the electrified. In and done Badal. But you make me fantasize. In and done Badal. Nothing but Banduna. Bangi to Banyu to know. We need to Bajal got to know. And Bajal got to know. Oh my God. Nelly Jato, we jagam my love. Jagam my heart. Nelly Jato, we jagam my heart. Put them on. Yana willing them. Will it go down? I'm so in love. Oh my word. You can be none there. Oh my word. Nothing but Banduna. Bangi to Banyu to know. We need to Bajal got to know. And Bajal got to know. Met the guy in the electrified. In and done Badal. Well, you make me fantasize. In and done Badal. Nothing but Banduna. Bangi to Banyu to know. We need to Bajal got to know. And Bajal got to know. And Bajal got to know. Bajal got to know.
Welcome back. I do see that Ustad Mading Maniel, welcome to Concerned Citizen of South Sudan. Also, I believe I put the link to everyone who wanted to come and participate tonight. Rajana, Ahlan Bek, Ustad Mading Maniel. It's been quite long time. I know last week, I'm glad we came here. So, shukran jazilan. Dr. Ajak Makhor spoke, gave a lot of good information about the COVID-19 and what went wrong and how it can be handled. He quite disagreed that actually lockdown is not a solution in a country like South Sudan. needed more resources. People need to involve local leaders, Salatin, Kenisa, Jawame, and etc. They need to be involved, and they need to work with these leaders so they can spread the message. And in the end, and all these things. They don't believe in this. Yeah, they don't believe in there is there is a virus here. So, تعليقك أستاذ مدين، تفضل. تفضل أستاذ مدين. تسمعني؟
There is an echo. I don't know what's going on.
Actually, that echo, it might be with something to do with the head. Yeah. كده أنت كويس معنا؟ بتسمعنا؟
Give me a second.
لا أنت كويس كده. I think I can hear you well.
There is an echo.
Yeah, if you want to go ahead and fix, if you want to fix that, take the headphone off, and then it would be okay.
I put it off, but still there is an echo.
Yeah, it looked like. في any device on around you there? Look, في device on
okay.
you.
All right.
Yeah.
Thank you. Let me put off my mobile.
Yeah.
No, let me put off my mobile.
Sure.
Yeah. Now can you hear me?
Yeah, perfect.
Okay, thank you, Brother Johnson.
Yeah. Let me remove you. You can come back. Can you try to come back or?
Yes.
Go ahead and come back and fix that, and then we'll be okay. And with that, Ajama, I already put the link. Let me go ahead and post the link here, and for people to come and participate. Okay, let me go ahead. I did that. دي حاجة مهمة يا جماعة. It's not ناس اللي بيخافوا من political discussion. They may come. Atong, you need to come. This is it just is not. It has link, but you still can come and participate and weigh in. So I posted the link there. ممكن to you, and you can participate. I know ناس بتاعنا sometimes في مواضيع كده they are kind of a little bit skeptical about this, but this is the national security issues of the country as well. لأنه COVID is a killer, and it is very dangerous, and it requires all of us to involve. شايف المعلومات اللي قالوا لنا الدكتور أجاك مخور معلومات مهمة جدا جدا. وشعب عنده دور، حكومة عنده دور الأكثر. But because they fail, شعب كمان don't trust them anymore. And انتوا شايفين الحاصل شنو. I hope all of you can come in tonight and weigh in your perspective. Let me go ahead and bring James Riak. James Riak, I do see you there. Hopefully.
Yeah.
I don't know, long time, James.
Yeah.
Yeah, very long time. And good to see you.
Long time. Can you see me?
Yeah. So, James Riak, you have heard Dr. Ajak Makhor.
Yeah, long time, Yonko. How are you?
I'm doing great. So I hope there is no echo on this thing. So we continue.
But I think it's repeating Yonko. I don't know.
Well, I don't hear it repeating it. I don't know what's the problem either. So, okay, let me do this. I will turn off this one. Give me one moment.
Okay.
Hopefully.
Yeah.
Is it okay now?
Yeah, I think it's okay. Yeah.
Okay. Then maybe it was from me. It wasn't from Mading Maniel.
Yeah, I think it's okay for me. Yeah.
Okay. So now, James Riak, go ahead and weigh in with your perspective. Fadal.
Yeah, thank you very much, Mr. Jonko. And first of all, I would like to thank Dr. Ajak. Yeah, thank you very much.
What happened?
I think something is wrong. Actually the delaying is on.
The delaying?
Yeah, the delaying.
The
kind of.
Everybody's hearing us very well. I don't see there any problem, but I don't know why this thing is happening. So can we should done for and then we see what's gonna happen. So I turned that one off. لكن انا مع الدكتور قبل كنا كويسين يعني ما في اي مشكله.
Yeah, you it was working very well with you and Dr. Ajak.
Yeah. So let me do this. كده
Yeah.
Because I'm hearing you very well. I don't hear any echo from my side. The viewers don't hear any echo as well.
Okay. Thank you, Jonko. Let's try it again and see. Okay. Okay.
Go ahead. Alan Big, Ustaz James Gadet.
I think let me use my phone. Cut me off, Jonko, and then I will join again.
Okay.
Let me use my phone.
Let me go ahead and do this. Welcome. Ustaz James Gadet. Is there an echo?
My DJ is son Gadet.
I apologize.
It's okay.
I apologize. Welcome, good to see you. Very long time. So let's move on, and then I want you to weigh in and move on from here. Dr. Ajak has spoken a lot, and we asked many questions tonight in this very important, episode of COVID-19 in Juba. So I want you to weigh in, my brother. Go ahead.
First of all, let me acknowledge to say to Almighty Man, thank you for this beautiful day. And second of all, let me say hi to all your viewers, the concerned citizens. And thirdly, let me say thank you to you, my brother Jonko. You are doing great jobs. Not sugar coding, as we know. You are doing a great job in our community, so keep going. I will go straight to the point, brother Jonko. Everyone has his different aspects to look at this issue, and I do believe I will take a little more time because this COVID, so-called COVID, it has a different form. It has a different way to acknowledge it. Now, let me go to the small background of the story of COVID-19. Because my brother, Doctor, he explained himself in terms of the medical field, his perspective very well, not objections, but the objection will come in terms of analogy, how and where and when, why the things go on. We all acknowledge the fact that the COVID-19 has started in China. Very, very brief. It's come from the sea, according to scientific studies. From the man, the professor of Liu in University of Harvard, when you were making investigation, he fulfilled it. The deadly disease comes from the sea, in which we're starting China. Now it has become pandemic. Short story. Let's go back to South Sudan. Our nation now has been shut down by President Salva Kiir Mayardit. How and where you're not going to tell me the COVID-19 is not a political issue? To me, on my aspect, it is a political problem. It is a political issue. Why and when? First of all, the COVID-19 started 2 years ago, or almost 3 years ago. Now we are in 21. 2019, when the COVID-19 started.
Oh, you talking?
How come?
Get it? You talking about the COVID-19, or you talking about the political crisis in the country?
No, it's coming. I'm coming to you, my brother. I'm coming to you. I'm leading to you.
No problem.
Because our nation has been locked down because of COVID-19, correct?
Yeah, but you talk about 3 years. That's why because COVID-19 2019. Okay, go ahead.
Yeah, I'm trying to lead you. I'm trying to lead you guys to the point.
Okay.
Because COVID-19 started 3 years ago. Now in our Republic of South Sudan, why they have to clear the what's so-called the emergency to lock down our nation in this year, and COVID has been existing for long 3 years. Why not? The nation was not shut down since the COVID-19 was started 2 years ago. This is the point I'm trying to lead our people. Okay. So the point that if you're going to come in 2021, in January 21, to lock down the nation, where have you been 2 years ago? Okay, that's where I'm leading my brother John Cole. Where have you been 2 years ago if you do believe the existence of the pandemic in our nation? Therefore, I do believe the pandemic in South Sudan has become a political arena, a political issue. Second question, and I asked a while ago, because I was writing a lot there, and I asked a while ago, why the only generals in South Sudan are dying? Why the only great generals? As we speak now, I don't want to mention the name. I do still have some people that have been transported to an unknown place as we speak now, and I know them by their name, generals. Why only generals, why only leaders are dying with the COVID-19? So this question we need to ask. Thirdly, where is the money has been given by the US? $8 million has been donated. What have we done with this kind of money? Now, when we look at this philosophy, this beautiful field of South Sudan, and look at it from different perspective and analogy in terms of medical, yes, there are things that are going wrong in our nation. Yes, it is a political issue. That's a point I'm trying to make to my former speaker, Dr. So yes, it is a political issue because South Sudan, we do not have even that high capability to endorse. And I was among those people who has volunteered for long 3 years, working in the hospital as a professional in terms of plasmatologist. I am plasmatologist, in which I'm laboratorian. We do not even have the national laboratory in order to preserve all these things. Now we're talking about the COVID-19. And the COVID-19, as the COVID-19 itself, it has gone. We have 3 different forms of COVID-19. We do not even have the medication or the vaccines to use against that new form of COVID-19. So my argument, to give the chance to other people, because there's a lot of things I will come over, my argument is that why they have to lock down South Sudan at this time in 2020. So thank you, my brother, for time. I'll give chance to others. If you want me to continue, I shall.
No, thank you. I'm going to go ahead and bring in James so he can weigh in as well. So let me go ahead and do this. I don't know what happened. Where James Riak, where are you? We want to give you that opportunity. Ajama Ta'alu, I know we are not going to just do too much today because this has something to do with science and health. So it might not be like usual, political analysis that we do every week. This thing is kind of a little bit different. But yeah, you can go ahead and join us and go ahead with your perspective. I send the link to various people and I'm waiting for them. Also, Ustaz Mading, where are you? Let me see. Oh, okay. Okay. No. So you can go ahead, brother Gadet, and then remove yourself, and then I'll bring you later if you have any other point that you wanted to make. I'll go ahead and bring you back later also. So James Riak, Sas Dengdit, and others, please go ahead. Link is down there. I don't know if you guys can see that. So you may just click on the link and it should lead you here. Oh yeah, it's very simple. I send link to a lot of people, who wanted to participate. Just go ahead and come and we'll give you this opportunity Okay, James, I see you are here. I hope this time it will work properly. James, is it okay now?
Yeah, let me try again, Junko, but I'm still hearing the delay.
We are hearing you, but I don't know. It has something to do with the Bluetooth or device that you have around you. Might be the case, because when Gadet came in, we didn't have any problem. So yeah, when Gadet came in, we didn't have any problem. Let me go ahead and Quad Mayan. It looked like
maybe it's my phone, but I put it off. I don't know why.
Yeah, I apologize. Quad Mayan, it looked like your network is very weak as well. It's not supportive. James, okay. Well, I don't know what to tell you, my brother, but you should continue because people are hearing you very well. So
okay, if people are hearing me very well, Junko, thank you very much to you and all the viewers. And also, I would like to say thank you to Dr. Ajak. He's someone I work with, actually. He's someone I worked with while I was in ABA some years back. And I enjoy coordinating and working with him. And I realized, having somebody like him working on COVID-19 response in South Sudan is also, key for us as a country to see how we can move forward. I will talk on 2 points, Mr. Jonko, which is one is the COVID-19 itself, and why, as a country, we fail in terms of the implementation. One, I responded to emergency response, the Ebola response in West Africa, and when Ebola is struck the country in West Africa, Guinea, Sierra Leone, and Liberia, there was misinformation. There was misinformation from the beginning. People were not aware about the disease. And as a result, many people died.
I think, James, maybe your Facebook tab is open. You got to close the other tab because you cannot have both of them. So if the Facebook tab is closed, and then this one will work properly, But go ahead.
Is it clear now? Can you hear me now?
Yeah, we hear you very well. You're the one that has the problem, but we don't have.
I think I closed the other tab. Thank you for the advice, and I believe now it is okay.
Okay. Go ahead.
Okay.
Continue. Yeah, we hear you.
Yeah. So as I was saying, in West Africa in 2014 to 2016, during Ebola, there were also misinformation. And those misinformation actually led to a result of, people dying, mostly the healthcare workers, as Dr. Ajak mentioned, because people were not aware about the disease. There was a lot of misinformation from the community, and those misperceptions, really killed many people. Also, with COVID-19, it is a new disease all over the world. People are not aware about it. People don't know about the mean of, prevention, and that affects, many countries in the world, in which our country was not exception. But the problem with us as South Sudanese, I will categorize it into 2. In any response, there are key aspects that we should look at. One is the coordination aspect, and then the implementation. For South Sudan, there have been lack of coordination, as I would say, and also Dr. Ajak confirmed by saying that the country has been, dominated by NGOs who are actually providing the services. And with that, it shows that there's a lack of coordination. I will not talk much about the preventive measures on COVID, because everyone, even non-medical, they know that. But I posed a question earlier, which I will say maybe Dr. Jack is listening, or any other person also can respond later. South Sudan has recorded over 8,000 cases of COVID. And those over 8,000 cases, about 4,000 has recovered with 100 deaths. We still have over 50% of the cases where we don't know where they are. Are they at home? Are they in the hospitals in South Sudan? Or where are they? And has the contact tracing been done? Because in any response, if there's no contact tracing, and then the cases are spread in the community and people, will continue dying. But as I was saying about the coordination, there's been a total failure from the top. As we all heard from the beginning, most government officials, senior government officials from South Sudan came out and said there's no corona in the country. What would you expect from the community to say? Secondly, they said they have, for example, banned large gathering. But we saw and we heard people are defecting. They go for large gathering, which they are welcomed by government officials, in which there are over 100 people gathering in one occasion. So,
go ahead.
COVID-19 prevention are very simple. The most important is the perception. Very simple in a way. If you maintain social distancing, if, for example, you continue with IPC practice, infection prevention and control, with hand washing, and then putting PPE in terms of face masks and also protective equipment for the healthcare workers in the health facility, COVID-19 can be contained very easily. But the problem is people are not taking their role. The government is supposed to coordinate in ensuring that there's a policy in place, there are regulations in place, and those regulations is not only just putting it in place, there should be enforcement. But if government are not believe about prevention that the policies they put in place, how would they expect the community to actually implement those policies? Secondly, Mr. Jonko, the second role is partners. The partners Dr. Ajak mentioned, partners are supposed to complement the effort of the government. All the partners in the country, they should be regulated by the government. I was surprised to hear that, NGOs, they are controlling our healthcare system, they are doing this. It is not their role to say that. It is the government to control what they're supposed to do. The third activities, which is the key, is the community engagement. Community engagement, which Dr. Ajak mentioned. But community engagement, for us, where I'm working at the moment, I'm working in a country in West Africa where I'm deeply involved in the response. But what we do, we work with communities, we engage the communities through community leaders, but we have policies in place to be implemented. But those policies, if you don't put them in place, The question is not engaging them. How would you engage the community? That question, how would you do that? You need to ensure that at least there is, a structure to be followed to engage the community. If you work together with communities should be able to control and contain the spread of the virus through, Dr. Ajak mentioned about the porous borders in our country. It is not the government to control those borders. It is the communities living across those borders.
How?
If they have been involved, they should be
the role of the government. James,
those borders.
Yeah, government has a role to play to control the borders, because it's the government is the one that, in charge of control of the borders. Go ahead.
The government, Mr. Jonko, the role. I'm talking about practical example.
Okay.
There are official borders that are known internationally in any country. That is the role of the government. Secondly, in terms of security, there are so many porous borders. There are so many porous borders in the country that are not, even if you put, for example, government officials, they will not be able to control. But the communities, like for example, there are communities that have been divided by international borders by mistake. They, for example, they cultivate here in this part of the country, and then they go to another country maybe to sell their products. It is only communities who knows themselves, and it's only communities that can control that, not the government. So that is what I was referring to. But for the community to take that action, it should be something that, coordinated by the government. And that's why we should have community engagement. For us as a country, to control COVID-19, we have to change our perception. We should change our perception. And our perception should be that the government should take leadership, regardless of the blame game, control the NGOs operating in the areas, form a committee that is actually representing the country, not only Juba, and also do mass testing, and also open so many centers and involve communities. If you do that, then our country will control the spread of COVID-19. It works in other countries. The regulation, I will agree with Dr. Ajak that if you look at the lockdown doesn't work. And I completely agree with him. It doesn't work. If you look at the duration, the incubation period of COVID-19, by the time that you release people, if people, for example, in the household, if you have one case, and then that case have another case, by the time that you release lockdown, the cycle will still continue. So I think our country, we just need to change our perception. And if we change that perception, we should be able to control the COVID-19. That is what I wanted to say, Mr. Jonko, that and also the viewers, that Dr. Ajak mentioned one thing that I want to, maybe before I end, is about the health system. Our health system in the country is very weak. And it's not only our country, as South Sudan, many countries in Africa, the health system is very weak. But there are questions that Dr. Ajak should ask. If you control, for example, the health system, do you have a governance in place, the health governance? Is it in place, the leadership aspect?
Go ahead.
Okay. Yeah. Okay, thank you. I think my network is kind of...
Yeah. Sometimes we'll put you on the screen. Sometimes we'll put you up. So go ahead.
Okay. No problem. I was saying there are questions that, we should ask. The government of South Sudan, the people of South Sudan should ask. The leadership and the governance of the healthcare system. for you to consider your healthcare system to be a strong health system, there must be the governance. And then the resources. Do you have the resources to improve your health system? And that improvement include the infrastructure of the health system. And then that will include the control of the flow of the information, which is the data. Dr. Ajak was preparing to that there are some information from the lab that are not going to the central system where a government can share information. There's a missing link in terms of the information sharing. So in the healthcare system, to improve that, you ensure that there's a data in place, there is, system of transferring information, and then you have the qualified human resource with the skill that can implement your strategy, and also the finances. Because everything that you do, will require finances. Does the government of South Sudan have the system in place to provide the health services in terms of infrastructure, in terms of finances, in terms of human resource, and in terms of the health government? If they have that, then they should be able to control NGOs. They should be able to talk on the table. They should be able to say, we are in charge. So there's question they need to ask them for the health system to be improved. Because when you have that, you will have a successful health services delivery, which is very good for the country. So the other thing that he was talking about in terms of the supply chain where we have push and pull system of the service delivery. The push and pull, now it is a top-down approach where it is a push system where a lot of medicine are delivered or are sent to the facility which they don't need. What we want to do when we improve that system, the health system is strengthening. The government of South Sudan should start a bottom-up approach. A bottom-up approach where it will be a demand created, looking at the need from the health facilities. If they do that, they should be able to assess the need in the country. They should be able to estimate the human resource required, the supply required, and also the governance. And with that, I think we will be in charge as a country. For now, I think our country needs a lot of work. And the last point that Dr. Ajak said, that we are in crisis, South Sudan is being attacked. It is a concern to all of us, and we need to work and advise our government to change the perception and involve the community. But more importantly, let's have the policy in place. Let's have the policy in place. Let's have the regulation. Let's have the enforcement. And then let's have the community leader taking charge. And let's talk about Corona, all of us. If we talk about Corona, all of us, we'll save many people. I believe many people are dying in the country because the report I saw say 102 people. But I believe it's over that. It should not be 102. We have many people who have died. So that is my contribution. My network has been checking. I don't know, but I still think you can get what I said, and that is my contribution. If there's any question, is welcome, Jonko.
Well, my dear brother James Riak, I don't have a lot of questions today, as you guys have noticed, because I already interviewed my guests, and now I give an opportunity for other South Sudanese to come and weigh in with their analysis as well. So this is what we are doing here tonight. I know it seems like it's a little bit, people are having difficulties long again. I don't know why. It should be easier. But yeah, thank you for your contribution. Thank you for coming on and adding your perspective. Let me go ahead to Mading Maniel. Ustad Mading Maniel, I want to give you a chance also to weigh in as well. We have heard from James Riak, and now I want to hear from you as well. Let me go ahead. If you are muted, it looks like you are not muted now. So let's hear from you. Faddal, Ustad Mading Maniel.
Thank you, Brother Jonkur. Thanks to all viewers for today, morning or night, wherever you are. Thanks to your previous speakers who really elaborate more about the pandemic coronavirus, which is really affecting our society or our country. Before I continue, first of all, please, I would like to extend my sincere condolences to the families, those who lost their loved one due to this coronavirus. It's very painful, and my heart is broken. أنا استمعت لضيفك الأول دكتور أجاك بحديثه. I salute him. كان كلام professional, person who is really professional. He talks sincerely about the situation back home in our country. But one thing which I would like to elaborate on is there are a few points which I really noticed from Ajak show or discussion tonight or today. Is one of the things is the concept itself of pandemic. The concept of pandemic itself is new to our people. How is new to our people? As you have mentioned, when the Spanish flu started in early 1918 up to 1990, it was a pandemic which killed not less than 30 million all over the world or more than that. But the fact is, human life, to come and tell somebody or to restrict somebody or his way of life, it's a bit difficult for people to consume, because it's a human being is being set in a certain way since you are born, and we don't have that more history of pandemic. وما الناس كتار العايش في فترة بتاع pandemic. It's a big challenge to humanity, not only in South Sudan, even we people who live here in Western countries. It was very difficult from the very beginning, and government worked very hard to educate the people through the media, through other means of education, and I think people start to pick up. And although our governments here in Western world, they have resources, في بلدنا ورا هناك our government don't have resources, and we know exactly. And I'm not going to elaborate much more about the lockdown وحاجات دي الناس كلام عنه. I'm going to talk about the health system itself as holistically, as in big picture. And one thing also which I would like also to mention to our viewers, this is not a political issue which we are discussing. I have my own political views, but I'm not going to politicize this issue. ما حنسيسه. It's a real problem, it's a danger, وده حياة المواطنين، ولو نحن ذاته معارضين وعايزين نحكم عن نحكم منه لو ما في شعب أصلا عشان نحكم. فده قضية قومية. It's a national issue. We need to discuss it with open-minded, and we need to be very sincere and address this issue. It's a serious issue affecting all of us, affecting any family in South Sudan, regardless being supporter of government or opposing the government who is in power today in Juba, the government of the day. But the reality is that Corona is killing our people. And what are we going to do? First of all, the health system, since the independence of Sudan and independence of South Sudan, ما عندنا حاجة اسمه master plan for the health in Sudan or in South Sudan. ما في. Since British left, ما عملنا حاجة اسمه master plan. The master plan in health is really helping the countries to determine what are the priorities regarding to the health. If you come today, Ajak has mentioned something very important. Between 72 to 76% of our health system is managed by NGOs, which is shame on us. After independence of our own country, our health system should not be managed by NGOs. Most of maybe in Juba and some few towns, but most of the village in South Sudan and small hospitals and shafakhanat, all are run by NGOs. NGOs, they dictate the terms, and they have right, because that the people who are running it, the facilities they have. We do have a good budget for health in South Sudan before this economic situation in the country. Since 2006 and 2007 until recently, the health budget was really huge, but we failed to do one thing. What we have achieved, we have constructed some hospital, but we failed to build hospital. What's the difference here? Constructing a building as hospital is totally different than a hospital which is with content, which is the equipment, the cadre which are trained cadre, and other things aspect. This is the hospital. It's not a building that I built.
الدكتور Ajak Makhor قبل يتكلم عنه. There is no ICU unit, which is intensive care unit. ما في.
Exactly. You might have seen some very beautiful building in South Sudan, and people say they're hospital. They are constructed building really, but they're not hospital in terms of hospital, because there's no component of hospital existing in those buildings. That's why we have a lot of issues of health issues in South Sudan. But when you come to the concept of people and how the people perceive the coronavirus, Dr. Ajak spoke about the issues, the cultural issues related and social issues related to this coronavirus. People don't respect the healthcare, the health system, the health advice, and so on and so forth. The reality is this: one thing people don't understand, and particularly in countries like South Sudan, the human being self. What's the human being? We are human. We have been created by God as human. But human has two things. We have a spiritual aspect of human, and we have biological aspect of human. We are biological machine. You may have that belief that you are a Muslim or Christian or Jongdid or Kujur or whatever it is. This spiritually can help you to link you with your creator. But your biological body, which is the machine, is functioning in different way. And the way it's functioning got nothing to do with your spiritual. That's why you need doctor, you need advice, you need all these things. This concept, our people need to understand that the human is a compound of two different things work together. It's sometimes really the spiritual could help in biological things, but not always that the spiritual will help you in biological things. That's why if you talk about it doesn't work like that. It doesn't work like that. We have to be very practical, and we are putting the life of people in danger. We need to be very practical and don't talk about the issues which are really scientific and the issues who are really affecting the life of the people. Now we have lost so many people. And those people, some of them, they were liberators. Our liberators, we lost them, our loved one, due to this corona. People have to understand this corona is not a political issue, just only a political issue. It's not a Nuer versus Denka or Denka versus Equatorian. It's killing everyone. Being a Nuer, being a Denka, being an Equatorian is a danger thing. We need to look into this as a national national crisis, national health crisis. As a national health crisis, we need to work on this. For example, if you come, you can see how we deteriorated. How did the other countries they advance? For example, Cuba. The life expectancy in Cuba is 78, which is almost equal to USA. We now is 57%. We are 57 now, South Sudan. The life expectancy of somebody in South Sudan is 57. When we were in Sudan together, Sudan now is 65. Why did we drop from 65 when we were one country? Now it's 57. Uganda is 61. Let's say 62, sorry, point something. This, even in the region, we're still lacking behind in this issue of health. We need to be addressed. Dr. Ajak talked about a very important point, which I also pick up, is about the law. Because there is no any laws being passed by Parliament, health laws are not being passed by Parliament. And you talk about
let me go back to you on that, on the law issues. But I would like to welcome Dr. Makhor, actually, who has been very vocal about these issues for a very long time. Dr. Makhor, welcome to Concerned Citizen of South Sudan. And actually, can you unmute yourself? Go ahead and unmute yourself. Okay. So we can give you an opportunity here to weigh in as well.
Hello? Okay. Yeah. Sorry, I'm having issues with my echo here.
So you still have it now? Because now we are hearing you clearly. So... Yeah, that's
that. Okay, there is some problem with my computer. So what I'll do is I will log off and then I'll log in from my phone. Okay.
So it looked like he has some issues. Ustaz Mading Manyel, you may come back as well. Anus Dr. Mawuna caught in the problem, and I do see that Benjamin also is down here on the studio. I can bring you, and you can weigh in as quick as you can, and then we move on. All right, Benjamin Akol, welcome to Concerned Citizen of South Sudan. Unmute yourself. Can you unmute yourself? Unmute yourself.
Unmute myself. Okay.
No, yeah, okay. Go ahead. Go ahead, Benjamin.
Yes. Yeah, thank you, Jonko, for welcoming me to your Concerned Citizen show. And I love the topics because I just came there. I think I've been like 4 days now or 5 days here in US.
From where?
I've been from South Sudan. I've been in South Sudan for 4 months.
Okay, that's
so I
good.
just came.
Welcome back.
Last week. Yeah, thank you. Anyway, I'm not a doctor. For those who may think that I have a profession in health, no, I'm not a doctor. But at least I can. I'd love to talk about this because when I went to South Sudan, I like to observe a lot, and I've been seeing a lot of things, and then was taking care, like taking careful way of studying what is going on. Yeah, Jonkor, we have issue. South Sudan is behind. I think what we have to know is that we are still at the Stone Age, because when I went to Juba, I went last year, and first of all, I found people that didn't have masks. A lot of people were not wearing masks, and the health law were imposed in the airport. We fill out the papers. They check on us. They even sprayed our shoes with I don't know what they were using, and they spray some like chemical on us. I was wearing suit, and they spray on me that they think that I came with coronavirus, which was good. I was so happy that it will be under control, like the way they were doing it. But as soon as I land down and exit the airport to the city, I was checking my head, because a lot of people were not even wearing masks, and it is a dangerous thing. So our people are very ignorant, to the point that you wouldn't even blame anybody else. So our people ignore coronavirus. It is just a God that helped South Sudan. People talk about it. People are dying among them, but they are not taking cautious to be careful to themselves. And that is why now a lot of people are dying, and they don't know this disease is targeting elderly people that have stories and have knowledge about our country. They are now dying among young people, and we are dealing with issues that are not even helping us. So Mading Maniel, I appreciate him when he said that this is not about government or any tribe. It is about all of us. And some people, when they go to South Sudan, they don't take a look of what is going on with our people. We have ignorance. We South Sudanese, we don't think how we can move forward, how we can save that country and make that country powerful for us or lovely for us. You can observe from grassroots all the way. NGOs are the one playing big role in South Sudan, because NGOs are there doing their mission that they want about. They are interested in South Sudan.
Benjamin.
Yes.
But at the same time, yes, you're saying that our population are ignorant. But don't you see that if authorities are, now you are in Chicago, when you landed in Chicago, if you are not wearing masks, you are going to be in trouble. If you go to work, and if you are not doing what you are doing, you are going to be in trouble. So enforcement, it has nothing to do with just only ordinary citizens. If the authorities are not enforcing what they call for, and then people will say, okay, they are not asking, they are not, and then they are ignoring it. Don't you see that aspect as well?
Well, yes. In Chicago here, if you go to McDonald's or you go to any restaurant, they will say, hey, can you wear a mask? It means that people who are owning that restaurant or people who are working in that restaurant are not being ignorant. They tell you that you are being ignorant, you have to have mask, otherwise you are not entering our restaurant. Yes, when I was there in South Sudan, it was imposed that no gathering, no parties, no football gathering or football league that should be allowed. And I own the club. I'm a leader of one of the big clubs in Awil. When I went there, it was announced that there should be no football that should be played, so that they can prevent, spreading of virus. And people ignore it. You can find some South Sudanese still have concept.
Were you in Juba when one of the call themselves quote unquote, businesswoman Ajaiwir, when when she organized a big party, that president came and spoke. At the same time, the lockdown was imposed, and president came, and people were bundled there. Were you there?
Well, yes, with a Nigerian singer, yes. That guy made a lot.
Tanzanian singer. So who made a mistake here now? Who to be blamed in this case? President was there and he spoke.
Yes.
Go ahead.
Yes, Junko, you know why we came to your show? Because you make this show, right?
Correct.
And because we come to you and spoke in your show here and speak in your show is because we are following you. You controlling us now. That's why we come to you. So that's why I'm telling you that we South Sudanese are very ignorant because we don't know what we are doing. Look, at that time, I think President should have not accepted to come there. But politically, I think he came there and he spoke there for some reason that motivated him, or he might have come there to see Tanzania singer because he's so famous. I don't know. He came there to show up to the people. I don't know, but I call that ignorance.
That's why I disagree when we're blaming ordinary Masakin. Yeah. That's why I said Masakin sometimes, because if the top leadership are imposing or they are just about signing the law and then they are breaking it very the same days, what do you think other people are going to do? Of course,
I call that ignorant because, like now in Chicago here, if the Bulls are playing and I know that there's a virus here killing people, I will stay in my own indoor. I will not even go out and watch Chicago Bulls, or I won't even buy a ticket to go there. And imagine our people were paying $200, $500, $400, $300 to enter that concert for that Tanzanian guy. And then you can wonder, when I was there, I was talking to some friend. We were analyzing about how these guys make money in Juba, whereby some people are poor. Yep. And it is because all I learned, our people don't take things seriously, and they don't see how they can catch up with the world in terms of power, in terms of economy, in terms of education, in terms of anything. Our people are so ignorant at all. They cannot come. They are not overcoming obstacles that are going on in South Sudan. You know, if you can see, like when my brother was saying that, yes, we South Sudanese have to take things from a holistic approach. We have illiterate people that are in hierarchy. You know, they don't even know. Even some governors don't even know what to do. If you ask somebody with a paper of what they can do for the public, they will not even show you their plan. They are just there to be co-leaders. You know, we just like to be co-leaders, but we don't have ideas of what we can do to move up our people or to invest our people in something that can help us and move our country forward. We don't have that plan at all. That's why you can see now a health minister.
Who don't have that plan, my brother? Who would just take that blame?
Well, Jonkur, if you go now to be a governor, for example, and you want to fix the country immediately, you will be dismissed because somebody who want to fix the country is the one to be removed quicker than anyone who come and damage the country. You know, that I learned a lot when I was there from grassroots all the way to the top. Our people don't need people that are doing correct thing to them. You know, you can see intelligent doing something that is weird, something that can take them to the jail and dismiss them from the job, but nobody will even dismiss that person. There's a big corruption throughout, all over the country, you know, from corner to corner. And they are not seeing what they should do to help themselves. Coronavirus, they hear it a lot, and they hate it. When recently, when I came, it was declared that, there is a lockdown. People didn't like it. You know, I was talking to one of the lawyers, he was so upset that there's a lockdown being imposed, and they were ignoring it, and they were saying, they were doing it for political because they heard that Ajak Makhor was given green light to travel all over the state. That's why the government proposed that there is a lockdown. That's what they were making up. And they didn't know that coronavirus was killing them. But they were saying that rumors, that it is not true, it was imposed for political reason. And they were doing activities that are not even known. And our police are not doing their job either. They just hear on the news that there's a lockdown. They are not imposing the law. You know, everybody is busy doing different things. So when you see that and approach that with your approach, you can see and say, hey, we South Sudanese don't even know what we are doing at all, because it's not Juba alone where government is. If you go to the village, it is only God that is helping our people. They are not wearing masks. They are not doing anything. They are not even. They don't even have all these equipment that are needed. But it is very upset. It's very upset, Jonkor, because I believe one time when you go home, you will be cautious to study and see how people in the market, what they are doing, even at school. You can just observe what they are doing, what kind of teachers we have. We are just joking. South Sudan is joking completely. We are joking. So now I came with my mind straight up with what I want to do, and how I should do it. South Sudan is in big trouble, and it is all of us. We need to fix that country. We need to fight to do the right thing. Yeah.
I want to give Dr. Mayuen a chance, because we want to divide now equally 10 minutes or 5 minutes, so we can all get at the same time. Thank you. You make really good point here, Benjamin Akol. Thank you for coming. Dr. Mayuen Akot, welcome to Concerned Citizen of South Sudan. I know the echo was giving you a hard time and you were not able to speak. From medical professional doctor perspective, Dr. Dr. Ajak Makhor has spoken. He lay a lot of things down, and Dr. Ajak actually disagreed with the lockdown, because it's a country like South Sudan, people are surviving on the daily basis. They want to go out and get something to eat. If you lock them down, it's not going to help anything. They're still going to go out anyway, because you did not provide whatever they need. Now my brother called Benjamin in Chicago. I am here in Seattle. When we had a lockdown, I did not pay my rent because my job cut for a few hours, and then I used to do Uber. I don't have Uber anymore. Our governor said, don't pay rent, don't pay electricity. Yeah, he said that you don't have to, and they make it like a law. Landlord cannot evict you. They cannot tell you, they cannot evict you. If they evict you, they will be in trouble. But later, Akuma gidrin yet fagurush of course, America, because they can do that. Like that's why we have lockdown was very successful. Like if you Sudan, Dr. Ajak is making sense, because you lock them down and you don't provide, you don't mabdadim fasulia, wala bdadim sukkar, wala bdadim dagik, wala bdadim yaja. How are they going to survive? They're going to come out, and if they come out, they are going to be super spreader, like we say in America. They're going to spread this coronavirus everywhere. So, Dr. Mayuen, I want to give you that opportunity from, a medical professional doctor perspective. Please go ahead.
Thank you very much, Brother Jonkor, and thanks to all the viewers, and many thanks to my colleague, Dr. Ajak. I've been listening to what he has to say, and he has been very, articulative in all the points that he laid out. And I think as a medical doctor and part of the medical panel, I see hope, actually, that people like Dr. Ajak are there to give advice. Now, it is a different thing whether the government will actually abide by it or not. During the start of COVID-19, I have spoken on many platforms, COVID-19, and reflecting on the situation in Juba. One of the things that I said, when people start laughing, they're saying, oh, we only have 2 cases of COVID in Juba, and those are from foreigners. And even the information minister, Mكهور, who always, anyways, I don't give any so much respect for his opinion anyways, because whatever he says, he said that there was no COVID-19 in South Sudan. And it came to appear that, we have this. I said, from the medical point of view, let us not laugh. South Sudan is more vulnerable. It's going to be affected by COVID directly and indirectly. Directly, people that are affected by COVID-19 and having a poor health infrastructure. For example, no ICUs in the country, no intensive care units, So it's even become counterproductive when somebody is sick and you tell them, oh, go to the hospital. To do what? To do what? They might as well die in dignity at home. Because if you are going to the hospital, you are not breathing, you are not going to get intubated, there is no oxygen. And we know that there is no medicine for COVID. So what is the difference between dying at home and dying in the hospital? The other indirect effects of COVID, a lot of people died. We have big chunk of our population that depend on medical health services from abroad. When the countries locked down their borders, we were left to die. And why? It's because we don't have a good healthcare system in our country. We don't have good hospitals. We don't have well-trained medical professionals. I don't know if there is any one South Sudanese who has trained as an intensivist. An intensivist the الدكتور اللي بيكون شغال في intensive care unit. The specialist in this intensive care. We don't have one person in the whole South Sudan. So there are still more challenges. Even if you build ICU units, you need training. How many respiratory therapists, those who can operate ventilators, are there in South Sudan? I don't know. So from the very start, when I went back home to South Sudan in 2013, I spoke to the government officials, to the healthcare officials, that our healthcare system needs attention, because one day we may have a problem where none of us will be able to access care somewhere else than the South Sudan. Of course, I didn't know that COVID will come, but I said that looking at how bad the healthcare system was. Our hospitals are actually sources for disease transmission. If you have a hospital that is not regularly clean, no bathrooms, people are urinating anywhere they can find, people are, there is no kitchen. You get patients cooking in the hospital yard for, or their relatives. Some people, even in Juba teaching hospital, they wash their clothes and they hang them up في هوش بتاع المستشفى. الوساخة بتاع المستشفى. We are not even able to move to the dumpster عشان يشيلوا البايوهازارد material ده يودوه الهالة اللي بيدفنون فيه ولا بيعملوا هنا مخلفات المستشفى ما في. So we are actually in a very bad situation. And then there is a mix of what I call political medicine. And I think Brother Dr. Ajak may be facing the same thing. As a medical professional, he said that they are not for a lockdown, but the government is doing it maybe because of others say for political reasons. And mixing medicine and politics, it loses people's life. It's a serious business. So in the countries that we are in, like now here in Alberta, I'm in Edmonton, Alberta, Canada. I'm a part of community engagement team dealing with COVID-19. It's sponsored by Alberta Health Services, by the city of Edmonton, and that is to engage communities to take full charge of their health. And that's what Dr. Ajak was saying. It's not only about passing a law or enforcing a law. It's actually getting people involved in the decision making. One of the things that we realize here, we have challenges. For example, in the South Sudanese community, you may find a family of 7 or 8 living together in the same household. If somebody needs to isolate, what do they do? Now, here in Edmonton, if you want to self-isolate and you can't, the government will pay a hotel for 14 days. And they will even give you money. In South Sudan, when you tell people that you have locked them down and no food, no water, you are basically sentencing them to death. And they are going to come out. So the lockdown, what these politicians involved with the healthcare system in South Sudan are doing is copy and paste. If this country locks down, then let's do it. Maybe that's the right thing. But they don't know about the consequences.
And resources behind.
Yeah, the resources to do that. Yes, lockdown is a good thing from a medical point of view. The countries that have made a good lockdown, for example, Australia, China, they are now actually going to concerts. They have lifted restrictions because when they did the lockdown, they locked down really good. For us here in North America, there is also some politics involved. So when we go for a lockdown, we don't go for a complete lockdown. And that's why we have a lot of cases. So, Brother Jonkor, I really thank you for, discussing this topic. I have a lot more to say, but I just came here to compliment what my colleague, Dr. Ajak, has spoken about. I actually, compliment him for his courage to speak the truth. I know some of the things that he was talking about are things that people in Juba don't want to hear about. They don't want to hear about that you're not getting your salaries, Dr. Ajak. They don't want to hear that things are bad in the country and they need to be fixed. But this is the reality of the situation. And so I thank you very much for candidly putting everything in the perspective. And I thank you so much, Brother Jonkor, and all the viewers.
Well, Dr. Mayuen, thank you so much, for coming on and adding your perspective. Yeah. It is so important. This has something to do with the healthcare profession. And that's why I said yesterday, medical doctor expert, this is an opportunity for them to come and help us, we can get this advice. As we're getting this advice, people are getting advice back home too. The Sahara, Corona is not. Corona is not paid. Corona Corona is real, and is something that it's killing people. And we have seen how many elderly in South Sudan have died already. Nas garin dusu kalamda ma bugulu ayan be corona ma bugulu de corona uzulu mat be corona oh mat gulu mat be corona. Why? Marad de kaman fadiha? No, it is not. So thank you so much, Dr. Mawuna Akot. Let me go ahead to you, my dear brother, Ustaz Mading Maniel, so you can weigh in, and then I will come to a call, Benjamin, and then we move on from there, so I can bring other people to add their perspective as well. Go ahead, Mading Maniel.
Thank you very much, Brother Jonkor. Thanks to Dr. Mayuen for your elaboration, and also thanks to Brother Benjamin. Anna, I was when Anna put the issue of the law to be issued. The law, which is still not being acted from the Parliament today. What Dr. Ajak was talking about is how they can apply a law while there's not been acted by the Parliament. There's a lot of there is some kind of contradiction here. Even if the law is acted, and you and Dr. Ajak was saying that people of South Sudan is going to avoid the law, how it's going to work, how it's going to function. There is no black and white in these issues. Yes. The government has a responsibility, not its own citizens, regardless of there's a law or there's no law. There are so many ways people can do. We here in Australia, as Dr. Mayuen has mentioned, there was a lockdown. There was no law being passed in Parliament regarding the lockdown. But the government is responsible of life of the people. And that's the government have to take that responsibility. That is one thing. The second thing, because it's the issue of the health. Health is a priority. It's not a privilege, only is a priority, and it's responsibility for the government to provide health to its own citizens. It's a fundamental right. And these fundamental rights, if you think as a government this health is not necessary, That's you're wrong totally, because an healthy society cannot be productive, and if that society is not productive, you will not achieve the goals and prosperity in that society or in that country, because economic depend on somebody who is going to work and somebody who is healthy to work. And how you really generate revenues as a government to provide services to people like roads and other things if we don't have a healthy society? That need to be revisited by the government. We should have a very good budget for the health, not only the budget to import the military hardware, which is maybe more than 50% of the budget of South Sudan. We don't need that. This military hardware is going to be obsolete very soon, because the world is moving towards biological war, which we should be ready for that even, because nobody's going to use the Baba T-55 or T-75 or whatever. Nobody's going to use them anymore. They will be scrapped. People are going to use biological war. And I'm not going to accuse people about this corona as a biological war. Could be one of those things, can be used as biological war. Are we ready for that war? Do we have a research center? How much do we spend on research budget in South Sudan? Even today, if we import those vaccines, do we have really our own doctors or our own scientists who are going really to test it and find out if this vaccine really is viable? Is it not really going to affect the people, the ordinary people? Those things we need to look into them, because there is no any development which will happen in this world without having research, without having a good health system in the country. Health is the paramount. Health is the priority. Health is the basics. Health and education are the basics. It's not necessary that you have oil money. It's not necessary that you have everything. Even if you have oil, if you have everything, you have military hardware, people are dying now. There's an invisible enemy. This is coronavirus is an invisible enemy. And you need to combat this enemy in different ways. It's not just only that you talk about the lockdown. How you are going to be successful in lockdown? I'm here in Sydney, in Australia. The lockdown is successful here in Australia due to so many reasons and so many factors. And how we, the people of Australia, how do we really respect our government? How do we implement this lockdown? When the government implemented, even I used to go to work during the lockdown, because my nature of work, I have to provide services to people. But still also the government have a vision. The last thing is that, what is our role as South Sudanese in diaspora? How can we help our people back home? I'm very pleased for one thing. I have seen there's a group of medical doctors, including the Dr. that in the USA. They have a forum. They discuss this coronavirus, COVID-19, every week, I think once a week, with a lot of doctors involved in that. I need this message to be extended to all over the world, wherever our medical doctors are there, our scientists, where they are. We need to work hard and knock the doors from door to door in our countries of residency to tell them this is a situation. It's a humanity issue. We need to stand with these people. Otherwise, the human being can be extinct somewhere in the world due to the reason.
Correct. Low for real cooperation between, the authorities back home and expert medical doctors here in abroad as well. When I low for real cooperation between health care professional back home and here and abroad, South Sudan, Australia, in America, in Canada, all over. Magul, do you think they cannot just build, ICU unit in Sudan? They can do it. Like, the problem is there is no cooperation. Another they are coming to take over, they are coming to figure it out. Another they just feel like نظام العمل الجرمن زمان بعد الحرب العالمية الثانية, after the Second World War, German actually blocked any German that are outside there. They don't want to come. They don't even need their ideas. As you get a bit as a German, they don't accept dual citizens. You either be German or just, they give you a green card, whatever then they call it, visa for a couple of years, 10 years, all these things. But they do not accept. To prevent those who were outside. So, I don't know how to describe it. Another duo, they don't feel good with nothing outside. And that's not going to take country anywhere. Because in order to build this nation, they need cooperation together. They don't need to feel threatened by those who are here, by those who are there, by those who are in East Africa. Because at the end of the day, it's the benefit of the country, interest of the country person. Go ahead, Kamil.
Yeah, absolutely, you're right. Absolutely, John, you're absolutely right. This is the thing. We have one.
I'm hearing noise
here.
in the background. I'm not.
Is it? Yeah, there is a mindset. Our mindset is one of the issues really we are facing. We need to change our mindset. What I mean by changing the mindset is not the issue of a government in the government of the day in Juba or being in opposition. I'm an opposition figure. I have an organization which we are represent. But this is a national issue. It's a national crisis which needs to be addressed by the people of South Sudan. Whether you are a medical doctor or non-medical doctor, whether you are residing in South Sudan or you reside in any one of the countries, we need to work hard for this. Working hard for this means that we need to revisit what can we do. What can we do? How can we cooperate with the people back home, particularly the professionals? You know, that's that direct government or even some organization. We can cooperate with them. What we need is how we rescue our people, first of all. That's a very, very valid point. And that's the responsibility of each of us as a citizen of South Sudan to rescue our people. It's not a matter of government only. We know this government failed, and it will continue to fail. But what can we do? Shall we just wait for this government to collapse and our people to finish? And then what are we going to talk about after that? Whom are we going to rule back home in South Sudan? If we need change, we need to work hard. We need to cooperate. We need to have a coordination. Australia, South Sudan, in Australia, in America, in Canada, in other parts of the world. What can we do? It's not the matter you're against the Salva Kiir government or you are supporting Salva Kiir government. It's not the matter that who is going to die. All of us are dying. Our people are dying. I'm sure in any family now, you lost one of your loved ones due to COVID-19. That's my contribution. I have nothing much to add really because it's more technical. This subject is more technical, and I think the health system, the more people really can have that the input. I put a general view or political view on how things should work, how the health system should work, what can we contribute as the citizen of South Sudan. Thank you very much, Yonko. Thanks to our viewers also wherever they are.
Thank you. I really appreciate you, Ustaz Mading Manyin, for coming in and weighing in your perspective. Yes, indeed, it is very much, health professional, and that's why actually I was inviting nerds. If you are a nurse, if you are a healthcare worker, and all these doctors, abroad. I don't know why they don't want to come and be part of this, so we can benefit from you, and people can benefit from you back home. We are not just talking politically, but they have link. They do have link. Ustaz Benjamin, I'm back to you. I want you to go ahead and finish your thought, and then we'll move on. I can bring other people too. Fadal, Ustaz Benjamin.
Thank you, Jonko, for having me back again. Yes, I'm just not a professional health person that is now contributing to your show here. Yes. Yeah, Jonko, we are tribalist mindset people in South Sudan. For example, let's say now we have enough doctors all over the world, South Sudanese, or in South Sudan itself. You never see our doctors see themselves as one community that can lead South Sudan out of crisis in 10 years. For example, if you are, let's say, if you are a Dinka or Equatorian with a health professional, and you can go to the community and see wrong thing going on and try to say, hey, this is not right, we don't do this. They will say, they are good.
They are good. As a Kadishub, Dr. Taban. Dr. Taban, who is beneficial from Taban now as South African. South Africa, even he's using tube, to suck all the mucus from pain. That Zol can Sudan will benefit if we have what they call the medical equipment. For South Africa to make a medical the medicine there in South Africa. You saw him on CNN, you saw him everywhere. It's a proud South Sudan,
Now, there's no cooperation in South Sudan at all. We don't see ourselves as leaders in any field. That's what I have observed. And what I do when I go home, I encourage young people. I tell them, leave political career. Don't go to Juba University for just political. Just being a doctor is a self-employed. You can just finish and start your own clinic, or 3 to 5 doctors can come together and start their own clinic, and you can make money right away. When I went there, Jonko, there's a big thing of this cataract is a big issue in South Sudan. There was a Nigerian guy. He was in the village. In a village now, in your village and my village, he was going from door to door, making surgery of cataract. From those people who get blind, he's helping people. You just pay him $72,000, which is equivalent to $130 a year, and he will operate your eyes. A lot of people who have cows were selling cows and then going to him. So, and then we have lack of that a lot in South Sudan. Like you now, you are a journalist, and there's no cooperation. Like other journalists coming together and see themselves as South Sudanese journalists who can report accurate information. All we do is just to tribalize and glorify individual who accomplish something and make him a tribal person that can do something for the tribe. And he's not seeing himself that he's doing something. When I came here, I lastly went to the Queen Clinic in Juba. I don't know, I saw the list of doctors. I think majority of them came from outside South Sudan. I saw the list of professional doctors who are there. That hospital actually, they tested me of coronavirus because you cannot come here without a one-day test. They tested me, and I was even doubt that there are no equipment that they can check me. And right away they did right thing. They gave me a good certificate that I was using all the way to here. South Sudanese, we are very far away. I think it will take us 100 years to understand how the world operate, because there is no cooperation, there's no partnership among us. But now at least few professionals are now trying their best as they can in Juba. As Queen Clinic, when I saw Queen Clinic in Namatalata, Queen Clinic was recommended. There were three. There was the mid blue.
There was mid blue. I know is the South Sudanese, but is the Queen Clinic South Sudanese as well?
Yeah, and Jongarang, the center that was built by the government for coronavirus, that was the third clinic whereby you can go for a test, or you can be admitted there if you have COVID-19. And yes, as Dr. Mayun and others mentioned, yes, South Sudan, if you go and see, we have a lot of problems that are creating themselves in South Sudan. You can go and see the papers, all the plastic papers all over. The batteries of radio are all over, and then any garbage all over. And when the rain, it just mixes with water, and our people are drinking that water. It's totally contaminated in our country. You see the sewage. People just use your latrine. When it's full, you just draw that with a tank and take it to the bush. Spread it around there. When the rain, it wags it to the rivers, and we are drinking those water that are not even purified. Few people use bottled water that is purified, but a majority of us in South Sudan are drinking from river with the dead water. So South Sudan actually is in a situation that if you go there and look down and think, you will know that it will take us 100 years to have a way of getting over all of this. Our young people are not even being encouraged to take medical seriously, like Cuba. Cuba imposed medical chance for every student to study medical. That's why Cuba now have more doctors than any country in the world. Cuba now is doing better in the medical system. But South Sudan, I think we should all encourage our young people, including us too. I'm still young. I think, I have a reason to say that I'm not going to be a doctor. But at least if we encourage our people that you can easily be self-employed if you are a medical doctor or a nurse in South Sudan. People with money, people with medical jobs are now making a lot of money, because South Sudanese, if you observe them, they like shortcut. They just take course for 1 month, 3 months, and say, "Hey, I'm a doctor," and it's another issue too. So I encourage our people to have cooperation. Doctors in Australia and US. I one time told Dr. Mayun that you guys should have like a group of people that can go one time, have eye surgeries or do anything during your vacation time and come back in any other field too. So I think one European guy was talking to me when we were coming. He gave me an example about Poland, that when Poland got independent, they were having issues of who can fix the cars, who can do what, who can cultivate. That's the same thing now in South Sudan. You just drive the car broke down, no parts, you just leave it there. You get sick, that's the day that you go to hospital. There's no even regular checkup. There are no things. But in terms of law, as Dr. Ajak was talking about law, there are laws in South Sudan, Jonkor, but people are illiterate. All the police, All the police are illiterate. They don't even know what is to be imposed as law to the people. You know, when you have law, you have to have people who went to school who know how to read and write to enforce the law. Like if you broke the law, they will know you break the law, number 9, number 10, and they will tell you that this is wrong, don't do this. But our people are, our police are illiterate. The only thing they can understand is when they are told that this guy is doing wrong thing, you guys go and arrest him. That's when they can do it. But the laws are there. The judiciary system wrote them. They are, when you read the book or you read the law, you can find them accurately written, and they are good. But who can enforce them? No one can enforce the law. Police even cannot know if a doctor breaks the law in the hospital. They will not even know what kind of law is doctor committed wrong in the hospital. They don't even know. You know, only people who are educated are the one who know that there are laws in Sudan, in South Sudan, but no one is imposing them because our police are not educated. Unless it will take them a generation who are now high school student or people who finish Form 4 to be recruited in a law system as police, so that they can know what they are imposing on people. Because police has to be there and know what you are doing wrong. If the police is sitting there without knowing what you are doing, you know, and they respect anybody who is educated, you know, it's because we are you can tell that we are in a situation that we need to work hard to come out of that. And South Sudan economically is good. You know, people who are poor in different countries see South Sudan as a good country for them because they go and easily make money, you know. But us South Sudanese, we don't know what we are doing. It will take us long and long. I think it will take us more years. I believe 20 years from now on, things will change gradually. But that's what I have to tell South Sudanese who are viewers here on your show, that we have a long way to go. We just like to be leaders. We like to be general. We like to be seen as big politicians. But at least we are not helping ourselves. We South Sudanese, we need to work hard to liberate ourselves from the condition we are in now. I feel sometimes that we should catch up with the world to compete with our neighbors militarily, to compete with our neighbors economically, and in any activities. You know, that's how we will all be happy and proud. But at least we need to work together. In anywhere, we need to cooperate and forget about tribal issues. If you are Equatorian and a doctor, you are a Dinka and a doctor, or a Nuer and a doctor, come together, form your group, go and build your clinic, and make money in South Sudan. So thank you.
Thank you, Benjamin. And I'm, pleased to have you on the show. And it's good that you came back, from home. It's good to see you back again. I was in Chicago last month. I didn't know that you travel already back home. So thank you so much, Benjamin, and it's good to have you. And I welcome Ustaz Wal-Katib Al-Kabir Dengdid Ajak to our program concerned citizen of South Sudan. We continue, as my brother said that, we need to liberate our mind, Bob Marley. And I see that Brother Edward Ajak shared this yesterday, has sung the song about he said that we need to emancipate our mind. We need to emancipate, from mental slavery. That's what he said. We need to emancipate ourselves to be free to think clearly and do the right thing. No one else. Bob Marley said that no one else is going to do it for you. It's just you. So it is so important. So Ustaz Dengdid Ajak, I welcome you. Welcome to Concerned Citizen of South Sudan. We have Dr. Ajak Makhor spoke and he laid out a lot of things and he disagreed with the lockdown for various reasons, A and B and C and D. So I want to get your perspective as well. Ustaz Dengdid, go ahead.
شكرا لك الأستاذ جونكور.
نعم.
على البرنامج الجميل ده، والتحية من خلالك للإخوة والأخوات المشاهدين. البرنامج تاع النهارده برنامج أنا بشيد به كثير، برنامج جميل جدا، لأنه الموضوع هنا يعني بنناقش فيه ده موضوع عنده بعد إنساني
نعم.
أكثر مما يكون يعني قضية سياسية. ولذلك كان لابد إنه يجي زول مختص أو زول متخصص في المجال،
نعم،
يعني طبيب بحجم الدكتور أجاك مخور هنا يوم، علشان ما يجي ويقدم لنا تنوير
نعم،
عام كده عن الوضع في البلد. والأجمل في الموضوع كله إنه هو شخص موجود على أرض الواقع، وشخص ضالع في الأنشطة المتعلق بهذا الجائحة المرض.
نعم.
ده كان مهم جدا إنه أجاك يجي ويتحدث حديثه الجميل اللي احنا كلنا سمعناه النهارده. له التحية، وأنا بقدر كلامه كثير. ده كلام بتاع زول صاحب مهنة، وده كلام بتاع زول يعني عارف هو بيقول في شنو. أنا هنا يعني أفتكر إنه دكتور أجاك ما جابوه هنا ده علشان ما هو يجي ينتقد الحكومة، لا، جايبينه أصلا كزول كادر طبي عشان ما يقدم لنا تنوير ويقدم لنا نصائح والتوعية والوضع العام عن المرض بتاع الكورونا. قاعد يقتل الناس اليومين ده في جوبا، وشفنا يعني موت بتاع ناس كبار، جنرالات في الجيش وسياسيين بارزين أمثال تلال رينج وغيرهم، لهم الرحمة يعني جميعا. وأني هنا بنقول إنه إذا كان الناس البارزين زي ده يا هو بقى يموتوا، فما بالك عن المساكين اللي ما معروفين. يعني الزول المسكين اللي قاعد ساعد ما معروف زي الناس اللي ماتوا دين. يبقى الموضوع خطير. تاني حاجة، الحديث عن الوفيات بتاع الكورونا
نعم
قاعد تنحصر بس في جوبا. يعني جوبا يا في موت كتير، يعني ما في أي حاجة عن الولايات. شكلنا نحن ما قدرنا نسأل الدكتور قبيل عن إنه الأوضاع بتاع كورونا في الولايات عامل كيف، لأنه الموت الكثير بسبب كورونا ده في جوبا كويس. فاحتمال المرة الجاية الناس يركزوا على الولايات برضو.
نعم.
عشان هنا كمان شنو ما نختزل السودان الجنوبي في جوبا بس زي ما الناس بيجي يقولوا ريبابليك اوف جوبا. صوت السودان بيجي جوبا بس، ناس كله قاعدين في جوبا وما في اخبار من الولايات الثانيه.
نعم.
انا ما عايز اختلف كثير مع الدكتور أجاك، لانه هو صاحب مهنه وهو زول طبيب.
نعم.
وحديثه حديث مبني على كلام علمي. احنا بس دايرين نعاقب في النقاط اللي هو اورده. وبالمناسبه يا استاذ جونكور، الحوار انت عملته الليله الحوار ده مهم جدا، وكشف لنا معلومات قيمه جدا. والتوبيك ذاته الموضوع بتاع النقاش مهم، لانه الموضوع ده موضوع متعلق بالصحه بتاعت البلد، الصحه بتاعت الشعب، ناس كله في البلد. ده مهم، متعلق بموضوع استراتيجي، يعني موضوع استراتيجي متعلق بالامن القومي بتاع البلد. والدكتور أجاك قال كلام جميل جدا، قال انه البلد تحت هجوم، البلد قاعد يتعرض لهجوم من المرض بتاع الكورونا فيروس. يبقى الشعب بتاعنا ده شعب يعني بقى هدف لهذا المرض، زي ما انه العالمين كله بقى هدف للمرض كويس. يبقى ده قضيه كبيره، ده قضيه كبيره جدا. في نقاط انا كتبته هنا بعلق عليه سريع كده عشان انا ابقى مارك، ولو في ناس ثانيين يقدر يجي يتكلموا. النقطه الاولى نقطه قاعده تتعلق بالاجراءات الوقائيه اللي اتخذتها الحكومه.
نعم.
والدكتور وضح بشكل جميل بانه الحكومة أعلنت الإجراءات بتاعت لوك داون، وكلنا تابعنا الكلام ده من السنة اللي فاتت. عملوا لوك داون، واللوك داون كان له مردود سلبي على المواطن، لأنه اللوك داون لما يتعمل ما في مواد غذائية يتوزع على الناس، وبالتالي الناس بقوا قاعدين في بيوت وما في حاجة يأكلوا، وفي النهاية الناس يضطروا شنو؟ إنه يكسروا الإجراءات بتاعت اللوك داون. ومش الناس أو مش المواطنين بس، الحكومة نفسها اضطرت إنها ترفع الإجراءات بتاعت الإغلاق جزئيا. الكلام ده السنة المشى 2020، لأن الحكومة لاحظت ذاته إنه الناس قاعدين في بيوت وجعانين ما عندهم حاجة، وهي ما قادرة تقدم لهم حاجة عشان هم يأكلوا في بيوتهم، فبالتالي فرض وضع اضطراري أدى إلى رفع الإجراءات بتاعت الإغلاق جزئيا. كويس؟ ورغم إنه قالوا إنه الإجراءات بتاعت الإغلاق رفعت جزئيا، إلى إنه من الملاحظ على حسب كلام بتاع الدكتور أجاك إنه أصلا ما كان في التزام من الحكومة أولا بهذه الإجراءات الاحترازية للحد من انتشار الجائحة، ده من جانب، وكذلك من جانب المواطنين إنه ما فيش التزام، لا حكومة التزمت لا المواطن التزم. يبقى دي مشكلة حقيقية. كويس؟ والحكومة حسب رصدنا للأنشطة بتاعتها، الحكومة من أول المخالفين. أنت تحدثت عن حفلة. كويس؟ ده واحد. في ناس انسلخوا من حزب بتاع أجاك مشار SPLMIO كان بقيادة بتاع أجاك بيشوب. ده لما اعلنوا اللوك داون بس بعد اسبوع ولا اسبوعين، الناس انسلخوا من حزب بتاع أجاك مشار وعملوا مؤتمر صحفي واعلنوا عن انسلاخهم، وكانوا يعني قاعدين كرسي جنب كرسي وما لابسين كمامات. وده كان اول يعني الرفض، لانه في مخالفه من ناس مسؤولين في الدوله او من جماعات بينتموا لتنظيمات سياسيه. كويس؟ ده كان الرصد. الرصد الثاني انه يعني في انشطه كثيره تم مع أجاك مشار ذاته، عمل النائب بتاعه المؤتمر بتاعه بتاع الIO يتعمل في فريدم هول
في ظل اللوك داون،
في ظل بتاع اللوك داون. الحوار الوطني برضه يتعمل في فريدم هول في ظل بتاع اللوك داون. دي كلها انشطه حكوميه، يعني انا ما بقدر بحسبها كلها، لكن ديل بس مجرد امثله. وانت بتعرف انه أجاك مشار كان بيسكن في بيراميد هوتيل اللي اهلنا بقي يسموه بيراميد. أجاك مشار كان في بيراميد هوتيل، ولإصابته بالكورونا فيروس اضطر انه يتم نقله من بيراميد هوتيل الى مقر اقامته في جبل، وتم عمل لوك داون ذاك للهوتيل يا جونكور. هوتيل كان تم اغلاقه.
انا المرض تفشي في الهوتيل كله.
ايوه، الناس كلهم طلعوهم وقفلوا البتاع. اظن رجعوا هسه الزمن داك. كويس؟ يبقى شنو؟ كلام بتاع الدكتور أجاك مخور انه ما في التزام من الحكومه، ده كلام في محله، لانه كلنا رصدنا الانشطه بتاعت الحكومه. خليك من الحاجه بتاعت السنه اللي فاتت، خلينا نجي للاسبوع اللوك داون الاخير اللي اعلنه حسين عبد الباقي ده نائب الرئيس. كويس؟ يوم 4/2 صح؟ لا، قبله وكان اعلنوا بشهر شهر 2 اعلنوا بتاع يوم 4 ده شهر 3 ده تجديد او ده تمديد بتاع الفتره بتاع اللوك داون. العمليه في شهر 2 انت عارف اول خرق للاجراء بتاع اللوك داون ده كان من الحزب بتاع الحركه الشعبيه في ولايه شرق الاستوائيه، الولايه بتاع الجنرال لويس لوبون لجوري. SPLM نظم له هناك معرض ندوه ولا شنو، يعني جمع لك هشد كده من المواطنين. وناس بيبقوا قاعدين جنب بعض وصوروهم وجابوهم في التلفزيون، في حين انه الحكومه المركزيه في جوبا اعلن لوك داون يعني في البلد كله. يبقى القضيه بتاع انه المسؤولين بيخالفوا الاجراءات هذا الاغلاق، ده كلام في محله ودلائل كثيره، وممكن بعد كده المشاهد يمشي قدام ويذكر الامثله كثير. بعدين شوف تقدير بتاع أجاك مخور للتطبيق بتاع الاجراءات الاغلاق، هو قال لو انا داير نبي تقدير، يعني لو داير يعمل ريتنج للنسبه بتاع التنفيذ، قال الريتنج بتاعه بيكون من 1 إلى 2، بدي 1 أو 2 من 10. ده بيعني شنو؟ ده ضعيف جدا. ده بيعني انه ده ضعيف جدا. يبقى النقطه بتاعت الاجراءات الحكومه او المخالفه، وناخذ حكومه على الجنب، نجي للمواطنين ذاته. كويس؟ المواطنين دكتور أجاك يتحدث عن استهتار، ويتحدث عن انه في ناس ذاته بيغبلوا الموتى اللي ماتوا بالمرض. كويس؟ ويتحدث عن انه الناس بيمشوا مآتم، لو في مأتم او في بكا الناس بيتجمعوا وبيتلموا هنا. كويس؟ وفي النهايه لخص كلامه بعنه انه في عدم وعي بالموضوع وفي استهتار بالموضوع، وانه الكونسبت مفهوم الناس للمرض يعني مفهوم كده ضعيف، او الناس بيستهتروا بالموضوع. كويس؟ فكان ده كلام قوي جدا يعني من دكتور أجاك مخور. يبقى المواطن لازم يستمع للرساله اللي قدمه الدكتور أجاك قبل، انه الناس ما تستخف بالجائحه دي، لانه نحن كلنا يا جماعه شفنا الناس ماتوا قبل شنو؟ في بلدان اوروبيه، حتى في الولايات المتحده البلد ده فوق يمكن ده سجل اعلى النسبه بتاعت الوفيات عالميا.
نحن الان اكثر
كده ممكن يجي وراه اسبانيا
اكثر من نص مليون، نحن الان اكثر من نص مليون.
نعم، الولايات المتحده الامريكيه اكثر البلدان المتضرره من اثار الجائحه، جائحه الكورونا. ثم بعد ذلك بتجي الدول الاوروبيه امثال اسبانيا، كويس، وبريطانيا والمانيا وغيرها من الدول الاوروبيه. بعد كده بيجينا بجاي في الدول الافريقيه. يمكن الدول الاسيويه ما تاثر كثير. كويس؟ دي حاجات مهمه جدا. يبقى الناس تستمع للدكتور في الرساله بتاعته اللي قدمه قبل، انه الناس تاخذ الموضوع ماخذ الجد، وتغسل يدك بصابون طوالي، وتعمل الاجراءات المعروفه عندنا ده كله. فدي نقطه رقم 1 اللي قاعد يتعلق بالاجراءات. انا متفق مع الدكتور انه في مخالفه من قبل السلطات اللي بيعلنوا الاجراءات دي، وانه المواطنين برضه بيخالفوا الاجراءات دي نسبه لجهلهم او لاستهتارهم بالمرض. المرض موجود والناس قاعدين بيموتوا. يعني في اسبوع واحد فقدنا اثنين جنرالات يعني من الجيش بتاعنا، ابرزهم الجنرال منيونج برج. كويس؟ زول ده يتوفى يعني الاسبوع المشهد ده. وفي جنرال ثاني برضه من الجيش معه يعني زميله، انا I don't know his name، برضه يتوفى. ناس يعني زي تيرار رينج، يعني زول كتب بس بعد يومين، كتب في السوشيال ميديا وبعد يومين زول ده يتوفى. كويس؟ وناس كتار يعني امبارح ابونا وعمنا الكبير الاستاذ جوزيف وكيل له الرحمه اتوفى امبارح.
نعم.
وما عرفنا هل ده كورونا ولا ده موت بتاع ربنا، ما عرفناه. كويس؟ لكن الناس بدا يتشككوا. كويس؟ عموما يعني احنا ما عندنا دخل نتكهن، لانه الاسره بتاعه بعد كده هيعلنوا هل ده وفاه طبيعي جدا بسبب مرض غير كورونا ولا ده كورونا. الاسره بعد كده ممكن يقدم تنوير للراي العام حول الموضوع ده، لكن ما عندنا حق نتكهن في هذا الامر. نقطه ثانيه بنضيفه، ده نقطه متعلق بالدوله. الدوله هسه ما قادر تفرض الاجراءات على الاغلاق على المواطنين بالقانون وده يمكن السبب اللي خلى الدولة تكون ضعيفة يا أستاذ جونكور، إنه الدولة ذاته اكتشفت إنه الإجراءات بتاعت اللوك داون من دون تقديم شيء للمواطنين صعبة على المواطنين. عشان كده الدولة ذاته اضطرت إن ترفع الإجراءات هذه الإغلاق جزئيا. لكن لما رفعتها جزئيا انزلق لشنو؟ انزلق للإفراط وإهمال ذاته. تفضل.
يا أنا كنت داير أقول بس في أخينا اسمه جوك أكول ذكرنا جوك أكوي إنه الجنرال تانا أنت كنت مع أنت نسيت قبل اسمه ليرا يوم الجنرال. يس شكرا له على إنه ذكر الاسم. ده كان مؤلم شديد، نفرين في أسبوع واحد يعني، وده الناس بيخدموا في الجيش. النقطة الثانية ذكر الدكتور ومتعلق بالنقطة متعلق بالدولة، نقطة هو قال هناك غياب للتمويل الخدمات الصحية. يعني دولتنا ذاتها ما عندها ميزانية بمول الخدمات الصحية. شوف الكلام ده يا أستاذ جونكور، ده كلام خطير جديد. يعني النسبة
حاجة اسمه الصحة بتاعت الدولة ما عندهم محل في ميزانيات بتاعت الدولة. ده كلام خطير شديد، وده بيعني انه شنو؟ المواطن متروك للرحمة بتاعت شنو؟ متروك تحت الرحمة بتاعت الأمراض. لو مرض جاء يموت بلا توقف، ولو ربنا ستر خلاص بينجو منه، لو ربنا ما ستر خلاص يمشوا. ده الوضع، وده وضع شنو؟ ده وضع خطير، وده بيكشف شنو؟ بيكشف انه الدولة ما موجودة بالمعنى المفترض يكون موجود به. ده بيعكس شنو يا أستاذ جونكور؟ ده بيعكس انهيار. أنا في 2012 و2013 كنت بعمل تغطيات صحفية لمداولات البرلمان، وكنت بحضر الجلسات المتعلقة بإجازة الميزانية أو الموازنة العامة بتاع الدولة. القروش اللي كان بتمشي للصحة كانت ضئيلة جدا، لكن الزمن ده البلد كان بخير اقتصاديا. هسه ده الجماعة لما دمروا البلد وعملوا الهرب حقهم، يا وصلنا لشنو؟ للنقطة اللي ذكر الدكتور إنه في غياب بتاع التمويل من قبل الدولة للقطاع الصحي أو للخدمات الصحية في الدولة، وبالتالي الدولة فقدت السيطرة على الصحة العامة، مرض من يدينه وبقى في يدين شنو؟ المنظمات الدولية أو المنظمات الأجنبية العاملة في البلد. يبقى ما في الدولة هنا، الدولة منهارة. وبعدين الصحة مش في يدين المنظمات وبس يا أستاذ جونكور، في دول الجوار، دول بتاع الجوار جانا أطباء من دول بتاع الجوار بشهادات مزورة، أصلا هم ما كوادر طبية. كويس؟ جو في جوبا وقاعدين بيمارسوا الطب كويس بطريقة غلط، والمواطنين بيموتوا بسبب الناس دي. ناس كتار كانوا قبضوا، والصحف او الاعلام بيتكلم على الناس دي. للحظه ان احنا ما عرفنا الناس دي لسه شغالين شغلهم الوصفان ده كويس ولا خلاص وقفوهم، لكن ما اعتقد انه يكون وقفوهم، بيكون لسه شغالين شغلهم ده. لما جنوب السودان ده بقول يا جماعه دامبينج اريا، وده من الحاجات المؤسفه شديد. ساوث السودان عملوه يعني مكب بتاع الغمامات، غمامه بتاعت سها بيجي بيكبوا لنا، غمامه بتاع الاكل يجي يكبوا لنا. الناس ما تمرض كيف والناس ما تموت كيف؟ كويس. يبقى بلدنا ده بلد الاداره السياسيه الموجوده فيها باينه من خلال هذه الحقائق انه هذه الاداره دي اداره موجوده فوق الكراسي من اجل لكن خدمه للمواطن كده بامانه يا اهلنا ما في خدمه للمواطن. على الضوء هذه الحقائق الجليله والجليه والباينه للعيان كله، يعني لكل الناس. فده ده 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 ده, ده مشاكل، يعني مشاكل حقيقيه. فنقطه المتعلقه بوجود الصحه في ايدي المنظمات الاجنبيه دي نقطه بيبكي ناس، لانه الليله العالم يتقدم والامن دخل في كل الحاجات يا استاذ جونكور وكل المشاهدين.
نعم.
يعني الدواء بتاعتك، الدواء اللي انت قاعد تعالج بيه المواطن لو بيتصنع برا وقاعد تستورده لازم تجيبه ويتم فحصه كويس.
نعم.
يتم فحصه كله قبل ما يمشي يستعملوه، لانه الليله الناس الحرب بتاع السلاح ده ما يبقى حرب براو. يعني ممكن يحاربوك من خلال الاكل، ممكن يحاربوك من خلال الادويه، ممكن يحاربوك بطرق شتى. يعني ما بالضروره انه يرسل طائره يدي له قنابل او يجي جيش يعمل غزو ارضيا، لا. فالمفهوم بتاع الامن القومي داخل في حاجات كثيره جدا، داخل في الاكل اللي احنا بناكله والمشروبات المستورده برا والادويه واشياء كثيره جدا. عشان كده الليله الدول المتقدمه وصلوا لدرجه انه يعني ما في حاجه هم بيجيبوه من برا، بيصنعوا حقهم من الداخل.
نعم.
لانه مفهوم الامن القومي اللي انت اشرت له قبل دي قضيه اساسيه ومربوط بالموضوع ده، مربوط بالموضوع ده يعني بطريقه ما ممكن يتفصل معه نهائي. فدي دي 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 يعني دي كارثه، بيوري انه الدوله بتاعتنا بقى ضعيفه للدرجه بتاعت انه يعني الدوله بقت ما فيش ذاتها، بقت ما فيش. لو موجوده ده موجود يعني بالاسم ساكن، لكن ما ببرنامج وبحاجه المفترض يتم تنفيذه. الدكتور برضه ذكر في حديثه بانه في غياب لقانون بتاع الصحه العامه. قانون بتاع الصحه العامه ده يا بتقدر تحاسب به اي زول قائم بالتجاوزات في الصحه بتاع المواطن. لطالما انه هذا القانون ما فيش، لو قبضت زول هتقدر تحاكمه باي قانون. يبقى دي يعني نقطه اساسيه اثار الدكتور أجاك مخور، ودي بيرجع لشنو؟ للدوله، وبيرجع للهيئه التشريعيه اللي قاعد تجيز القوانين في البلد.
نعم.
يبقى الحلقه بتاعت الليله ده يعني ده مش حلقه بتاعت حديث عن كورونا والتوعيه بتاعت كورونا، لا، ده حلقه مش ابعد لكده، اتناول ذاته يعني البرنامج الاستراتيجي الصحي بتاع الدوله. ده كان كلام بتاع الدكتور أجاك. دكتور أجاك برضه ذكر انه الدوله لازم تستفيد من العقول، الكوادر الصحيه. عندنا يعني كوادر صحيه، الناس دكاتره يعني متخصصين في شتى التخصصات الطبيه، انه دول يدوم فرص. وزي دكتور تعبان انت ذكرته قبل، شفنا الفيديوهات بتاعه كله في الاعلام يعني. كويس. يبقى في الدوله ما مستفيده من الكادر الطبي. وكلام بتاع الدكتور أجاك قبل اظن الرساله بتاعه يعني الرساله بتاعه كان انه البلد لازم يستفيد من الكوادر الطبيه بتاعتها.
نعم.
كويس. ده كان الكلام بتاع الدكتور، وده كلام جميل جدا، وده رساله قويه جدا. كويس. لكن وين اللي بيسمعنا؟ وين اللي بيقدر بينفذ الكلام ده؟
نعم.
كويس. نغاب يعني كبيره جدا. دكتور أجاك قال عباره ثانيه، وده يمكن العباره انا قلتها هسه بطرق مختلفه. قال ليس هناك سلامه صحيه في البلاد. اسمع الكلام ده استاذ جونكور وكل المتابعين.
نعم.
قال ما في سلامه صحيه. there is no health safety, there is no health insurance in the country. معناه اي زول ممكن يموت، انت تموت اني تايم. يعني الامراض البسيطه بيقتلنا، حاجات زي تايفود، حاجات زي ملاريا، الامراض الوبائيه اللي هو ذكروا قبل كويس. والكورونا ذاته بقى اخطرهم. يبقى لابد من استغلال بتاع العقول او الكوادر الصحيه والتوظيف قدراتهم في خدمه البلد كويس. لكن النقاط ده كله ورسائل الوجه الدكتور أجاك مخور للدوله كويس. ممكن انا اقول انه المناشدات بتاعته للمواطنين دي الرسائل دي الرسائل اللي ممكن تلقى فرصه او تلقى اذان صاغيه. لكن الرسائل المتعلقه بانه الدوله تحسن من الاوضاع الصحيه، وانه يكون في بنيه تحتيه متعلقه بالصحه، وانه الدوله تستفيد من الكادر الطبي، وانه يكون في معدات، وانه يكون في يعني نظام صحي متين في البلد، الحاجات دي ما اظن الحكومه الحاليه هتعملهم الا حكومه جديده. وعلشان كده نحن في هذا المنبر كنشطاء سياسيين بننادي بتغيير في بلدنا. لا نشوف المعلومات ده كله بيعكس شنو؟ بيعكس انه في قصور من الدوله. الناس القائمين على امر الدوله تركوا المواطن تحت الرهمه بتاعت المجاعه، تحت الرهمه بتاعت الدكاتره ما دكاتره اصلا، مواطن بيطعنوه بموت. تركوا الصحه بتاعت المواطن في يدين المنظمات. عملوا حاجات كثيره جدا. المنظمات العالميه اللي بيخدموا المواطن بتاع السودان الجنوبي باخلاص نحن بنشكرهم، واللي ما بيخدمونا باخلاص نحن بنقول لهم ربنا يجازيكم، ويوم يجي تغيير انتوا هتمشوا، ما في زول واحد فيكم هيفضل قاعد. يبقى الدكتور أجاك مخور يا استاذ جونكور افتكر يعني فتح صدره ويتحدث بامانه ويتحدث بوطنيه وبمهنيه بصفته زول طبيب يعني.
نعم.
لانه نحن افتكر جبناه في المنبر هنا عشان يتحدث كواحد من اهل الاختصاص، لانه نحن السياسيين دول ونحن ما عندنا علاقه بالطب ما بنقدر نتكلم في الموضوع ده الا زول طبيب يجيبه كويس، لانه ده قضيه استراتيجيه متعلق بامن بتاع الدوله ومتعلق بقاء بتاع الشعب، بقاء بتاع الدوله. لكن هذا البقاء الان الزول المفترض يحمي لنا البقاء بتاعتنا من ناحيه صحيه، من ناحيه اقتصاديه، من ناحيه امنيه، من ناحيه بتاعت معلومات، من نواحي كثيره جدا. الزول المفترض يحمينا هسه خلاص فقط كنترول، والملف بتاع الصحه فقط من يدينا. علشان كده نحن يا جماعه اهلنا في السودان الجنوبي، في كل مدن السودان الجنوبي، في جميع الولايات، اهلنا القاعدين برا في استراليا، في الولايات المتحده، في كندا، في بريطانيا وفي استراليا، واهلنا المنتشرين كلهم في الدول الافريقيه كويس، وفي الوطن العربي، بنقول يا جماعه انه ياهو بلدنا فرشوه الليله قدامنا كده، من الناحيه الصحيه فرشوه قدامنا كده، وكلنا شفنا انه الحكومه دي ساقطه سقوط غير عادي، انتهت. عشان كده الرساله بتاع التغيير لما نيجي ننادي بيه هنا، فلا بد انتم كلكم تأيدوا هذه الرساله، لانه ما في حاجه بيقدر بينقذنا الا ازاله هذه الاداره السياسيه العاجزه الغير قادره على اصلاح الاحوال للمواطنين. يا اخي الامن واقع، الامن بوجوهه كله واقع، كل شيء واقع في البلد. عشان كده وجب التغيير لهذا النظام السياسي لكيما يكون لدينا نظام سياسي جديد قادر على إدارة البلاد واستعادة الكرامة لهذا المواطن واستعادة الصحة المفقودة الآن لمواطنينا في جمهورية السودان الجنوبي وبجميع ولاياتها، واستغلال الكوادر والمؤهلات الصحية، الكوادر الصحية الموجودة في البلاد في كل تخصصات لخدمة المواطن. التعليم واقع، الصحة واقع. الصحة ده من الحاجات المفترض ما يقع، لأنه الصحة اللي وقع ده نهاية بتاعت البلد. ممكن نقول كلام الدكتور أجاك قالوا قبل إنه محاربة بتاعت كورونا ده فوق للطاقة بتاعت الحكومة. أنا بتفق معاه في النقطة ده. أنا بتفق معاه في نقطة فوق للطاقة بتاعت الحكومة، باعتبار إنه البلد ده بلد ضعيف ما فيه نظام صحي. أكبر حكومات الأرض بيعانوا الآن من تبعات هذا المرض، لكن نحن نقول إنه أبسط الإجراءات هذا الوقاية الحكومة كانت تفرض الإجراءات دي وتقدم مواد غذائية للمواطنين عشان ما شنو يخفف من الانتشار هذا المرض. لكن حكومتنا حكومة ما بتهتم بالمواطن، ودي البيت بتاع القصيد هنا. وعلشان كده الدكتور أجاك مخور يعني انتقد الإجراءات الخاصة بالإغلاق، وهو بيقول إنه هو ضد الإغلاق.
نعم.
وافتكر الأسباب اللي هو قدمه أسباب موضوعية، لأن أنت ما ممكن تعمل إغلاق ومواطن يقعد في البيت يكون جعان. احنا شفنا دول، يعني دول بيهتموا بالمواطن حقهم، بالإنسان حقهم. شفنا الرئيس بول كاغامي في رواندا عمل لوك داون ومنع المواطنين إنه ما يتحركوا، ووزعوا شنو كل شيء للمواطن. والكهرباء ذاته بقى بمجان للمواطن ما يدفع. الإيجارات في البيوت ذاته، the tenants who are renting, the landlords and the landladies should not ask قروش منهم.
ده كلام انا قلته قبل، لانه احنا هنا في الكاونتي على مستوى المحافظه شهر 3 4 5 6 الوالي قال لنا يا اخي انت ما تدفع قروش، ما تدفع ولو ما قادرين، وقال لي نازل ما تطرد اي زول من بيت، لو طردت زول you are going to be in trouble. لكن at the end of the day هم جا عوضوا نازل بعد كم كده جا عملوا لقاءات معاكم، يضرب لك تليفون يقول لك يا اخي انت زول داير منك كم، يقول لك داير كده، خلاص حكومه يمشي هناك يمشي يدفع، ما بدق له في يدك، لكن مين بيدفعوا له عشان انت ما تمشي يا اخي تلف في الشارع وتعمل انفكتد لاذرز، سبريد تعمل سبريد لكورونا فيروس، سبريد
ذا فيروس.
قلنا ده الناس اللي عندهم امكانيات، يس الدول دي عندها امكانيات، ما تدفع كهرباء، ما تدفع بيت، اقعد في بيتك، القروش اللي عندك ده ما تصرف في حاجه ثانيه، اكله انت. اوكي، لكن معقول اويل اللي احنا قاعدين نبيعه برا بقروش كتير، معقول 200 300 مليون دولار حكومه ممكن تستخدم مواد غذائيه temporarily لفتره مؤقته، فاصوليا، عدس، زيت، سكر، دقيق، ويقول للشعب يا اخي كل اسبوع يا اخي احنا بنعمل احياء ودلي وما اعرف ايه وايه وبتاع، انتوا تجي تصرف الحصه دي عشان تقعد في بيت. انا نازل بتلف ده لافه ليه؟ لان عايزه تاكل، ما في زول بيلف ساكن. Do you think they cannot do that? They can do it. لكن they chose not to do it. ويعمل هنا you know copy and paste like الدكتور أجاك قالوا قبل. وفي النهايه ما بوديك، لان انت ممكن تعمل lock down without program، ما عندك برنامج استراتيجي. Yeah, because Uganda locked down, I'm going to lock down. Because America locked down, well, they plan through it. We lock down, people are not working. لكن احنا بنأكلهم. اقعد في بيت، ما تلف. اوكي؟ قروش البسيطة اللي عندك ده use it for yourself. ما تدفع إيجار يا أخي، ما تدفع كهرباء، ما تدفع ديل كله. اقعد، احنا بنساعدك، لأن احنا عايزين ننقذ الأمة. To save the nation. ده الحكومات المسؤولة. نعم في ناس يقولوا لي يا أخي أنت are you making a contrast between South Sudan وأمريكا وديل؟ لا we are not. أنت بتتصرف حسب الإمكانيات البسيطة اللي عندك.
بالضبط.
أنت لو عندك you know نص دقيق ولا نص ملوى، أنت هتقول يا أخي أنا جزء ده أنا أكل الليلة وبكرة أنا أكل ده وبكرة أنا أكل هكذا. يا أخي عندك قروش ما تشتري، جيب للشعب، عملهم كذا عملهم كذا كل يوم. UN منظمات دوليه. طيب انت شغلك شنو؟ انت دوله. المهم كمل استاذ دينجي because we already spent 4 hours and أنا بكون طالع لأنه I have other stuff to do tonight, but it's very very important, you know, to bring this issue up so we can discuss it together. Go ahead.
والله أستاذ جونكور أفتكر أنه كلامي انتهى وأنت شرحت واستفدت كثير، وأنا أشكرك على اهتمامك إنك فكرت وجبت هذا الموضوع للنقاش. الكلام اللي أنا قلته الأخير ده هو الكلام بتاعتي، إنه change must come للبلد بتاعتنا لسبب دي ولأسباب تانية كثيرة جدا عشان ما نقدر نبني الدولة اللي نحن كلنا بنحلم به. thank you very much and thank to all the viewers بتاعت concerned citizen of South Sudan. وكل زول علق أنا شفته في تعليقات جميلة جدا قبل لما كنت بتابع.
نعم.
نشكر كل زول علق وأيد الموضوع بتاع البرنامج، والدكتور موين اللي كان هنا قبل وكل الإخوة اللي علقوا. ده كلام جميل، فشكرا لك وأنا بقيف لحد هنا ولينا اللقاء إن شاء الله.
شكرا جزيلا أستاذ دنجيت. is always great to have you. أنا أشكر في الختام كل من حضر وكل من شارك بالكومنت وبالفيديو. شكرا جزيلا لحسن المتابعة. I know the إخوة هنا بيقولوا يا أخي coronavirus cannot be controlled. Look what happened in the United States. Of course لو ما كان بذل الجهود في أمريكا عدد اللي كان بيموت كان يصل ملايين البشر كان يموت، لكن because they put that amount of effort, that's why they were able to minimize. هذا نزل ناس 500 وشوية ألف، نعم، لكن عشان عملوا. لكن هل نحن بس نقعد نتفرج؟ يعني anything that happened، لو في مشكلة حصل في بلد، في ناس اللي هو supported the government, they don't want any blame. Well, when you are in charge, my dear brother, you are going to be blamed and you have to do something. لكن when you are not doing something، أصلا زي مثلا أنا طرحته قبل، معقول في دولة تنظم حفلة وأنت عملت لوك داون وتجيب فنان من دولة تانية وتخلي شباب ده يجي كده يكون بندل كده في النص mingling, what are you doing then? You are contradicting yourself. You see what I'm talking about? Simple thing. بتقول ده فنان تنزاني جايبينه، قال سيدة الأعمال جايبه وتجي تتكلموا فيه. You are spreading the virus. You are spreading it among the population. That's what you're doing. You're supposed to be a safeguard. أنت المفروض تكون a safeguard for nation. But now you are contributing that. What does that mean? You are contradicting yourself. So that's why we are speaking about this. We are concerned, and we're concerned about any situation. ده موضوع إنساني زي ما أستاذ دنجيت أيوك ذكروا أكثر من إنه يكون موضوع سياسي. لكن yes, authorities are there to regulate and monitor and protect the شغل بتاعك. I know salaries were not paid, but in pandemic أنت تكون واقف متفرج مكتوب الأيادي وتقول لا I don't have that ability. فهنا أنت قاعد بي oil. That oil should be for them. Yeah, pay their salaries. At least you go to bed. So with that, I really appreciate all of you for coming on and participating. Yes, أنا عارفين في ظل الحكومة دي الحاجات اللي ذكر دي كلها ما بتتحقق إلا هم يمشوا. وعشان كده always we are appealing to all of you, all South Sudanese, to unite and remove this cancer from South Sudanese life. Thank you so much and have a wonderful night.
Al batal, al قلبي جنينة ودا حياتي قلبي ولد مانا يا تاي كان في بطل كان في كويس ويا رجل ما بيسيبه وانا كان في بطل كان في كويس انا مرة ما بيسيبه وانا نروح لنا رجل كويس ورجل بطل قلبي أقول لنا رجل كويس ورجل بطل وانا نروح لنا رجل كويس ورجل بطل قلبي أقول لنا رجل كويس ورجل بطل في حياتي كل يوم برام حرامي كاتبان سلا أقول ذاته برام حرامي كاتبان سلا في نوم بالبرام حرامي كاتبان دوري يا ذاته برام حرامي كاتبان أنا تير راجل قلبي لقول وأنا زبيدة أنا تير راجل قلبي وأنا زنسته أنا دي أنا راجل قلبي كفو مسؤوليات البين قلبي جنيم أنا قلبي حبو وأنا قلبي ناري أنا حنين وأنا نروح لنا رجل كويس ورجل بطل قلبي أقول لنا رجل كويس ورجل بطل وانا نروح لنا رجل كويس ورجل بطل قلبي أقول لنا رجل كويس ورجل بطل نسيا يا بوانا زواج باختيار ضربنا كويس نسيا يا بوانا ميرا كويس ودبي كويس عشان بيوصفوا قلب عينه تكون بيتا في لانديكو والسلام عشان يلتقوا برابا التربية الكويس كمان راجل الكويس better the beginning كويس راجل الكويس ربنا بيساعده كان في بطل كان في كويس ويا رجل ما بيسيبه انا كان في بطل كان في كويس انا مرة ما بيسيبه من نروح لنا رجل كويس ورجل بطل قلبي أقول لنا رجل كويس ورجل بطل وانا نروح لنا رجل كويس ورجل بطل قلبي أقول لنا رجل كويس ورجل بطل
So how many of you watching this were in a 9-to-5 job you disliked? You decided you'd had enough, you wanted to take matters into your own hands, so you went and started your own business, but now you've just